start at 11:30.
Okay, he can also hear you.
Oh,
The whole room can hear you.
I'm so sorry.
It's okay. Okay, I'm gonna mute my microphone, Tina, but I'll be available via message.
Good morning. Welcome to the August 12th, 2025 Nevada Office of Minority Health and Equity Third Quarter Advisory Committee meeting. My name is Tina Dortch, and I am the NOMHE Program Manager. For descriptive purposes, I am a Black woman. I'm wearing a burgundy short sleeve blouse with green floral accents, and I have my hair styled in thin twists. My background consists of me sitting against a plain white backdrop, and the virtual NOMHE logo should appear virtually in the upper right corner of my screen. I am one of NOMHE's staff supporting today's meeting, along with Dr. Siddharth Rach, Carlos Ramirez Gomez, Karina Fox, and Alexandra Neal. I sincerely apologize that I could not be with you in person today. However, the day is in good hands with NOMHE staff and our event planning support provided by the Nevada Public Health Foundation. Before we begin, may I please receive confirmation that the recording has begun for this meeting?
Recording has begun.
Let the record show that we are also supported by professional American Sign Language interpretation and that closed captioning is available. This is a hybrid meeting today with persons who are joining us in person at the Atlantis Casino Resort Spa in Reno, Nevada, and also remotely via the Teams platform. As a friendly reminder, please silence all our phones, and for anyone who is speaking, make sure you state your name each time before doing so that you can help us accurately transcribe our minutes. For members of the public who are joining remotely, when you are not speaking, we do ask that you please mute yourself and remain camera off. Each member of the advisory committee meeting who are joining remotely, we ask that you keep your cameras on and only unmute yourself when you're speaking, and you do so for the duration of the meeting, and that you plan to stay engaged until we conclude. For the non-advisory committee members who are joining remotely, specifically people who might be presenting, or for those who wish to provide comments during public comment section, only engage your cameras while you're speaking. And then for those who are joining us and plan to give public comment, withhold your statements until that portion of the agenda has been announced and the floor opens, and the chair is going to give you a bit more instructions momentarily. Our chair today, Mr. Nicholas Dunkel, will manage our agenda. Mr. Chair, the agenda is yours, and if you would please start by noting the time that the meeting is called to order.
Thank you so much, Program Manager Ms. Dortch. With that said, we will go ahead and call our meeting to order today at 11:32 a.m. With that said, we'd also like to jump into a quick roll call here. So for our roll call, would advisory committee members please acknowledge their presence when they hear their name called by our Program Manager, Ms. Dortch.
Thank you, Mr. Chair. Again, for the record, Tina Dortch. Nicholas Dunkel.
Present.
Dr. Samuel Hickson.
Present.
Angela Wilson.
Present.
Thank you. Tiara Flynn.
Present.
Dr. Andrew Thomas Reyes.
Present.
Reverend Dr. Deborah Whitlock Lax.
Present.
Nancy Bowen.
Present.
Bishop Bonnie Radden. Bishop, I know you were with us.
There. I'm sorry, I got kicked off for a minute. Bishop Bonnie Radden present.
And Margarita Salas Crespo.
Present.
Our ex officio legislative advisor this season is Senator Rochelle Nguyen. Is the senator with us today? The senator does have an excused absence. And Mr. Chair, I'm happy to say that we have full participation and quorum has been met.
Nick Dunkel for the record. Thank you so much, Ms. Dorch. With that said, welcome to all non-advisory committee members, public, guests, whether joining us either in person or here in Reno, or rather virtually. For those joining us in person, please be sure you have signed in. For those joining us virtually, I think that's supposed to say, please be sure you have signed in and please hold your comments up until public comment. With that said, I will go ahead and start with a bit of an opening statement here. So first and foremost, August is National Wellness Month, the period when we acknowledge individuals to prioritize their physical, mental, and emotional well-being. Given this month's designation, I'd like to focus my opening remarks on health and wellness related to observations taking place this month. The first observation I'd like to recognize is the International Overdose Awareness Day taking place on August 31st. Every August 31st, International Overdose Awareness Day brings a global community together to take action on overdose through events, both in person, online, through communities. We honor lives lost, educate their families, friends, and peers, and explore evidence-based overdose prevention solutions. Activities are typically driven by one of the 6 following principles. Overdose can and must be prevented. Overdose prevention solutions exist. Let's use them. Criminalizing drug use has not worked. Compassionate alternatives must be pursued. Policy and legislation must exist to protect individuals and communities, as well as ensure basic human rights and needs are met. Everyone has a right to respectful and comprehensive health care, and only a community-wide effort can end overdose. Our program manager, Ms. Dorch, has a related announcement that she will share during her updates a little bit later in our agenda. The second thing that I would like to mention here would be National Immunization Awareness Month. So you've no doubt noticed shifting priorities recently announced out of the U.S. Department of Health and Human Services. They happen to coincide with August, our observation of immunization awareness. Every August, we choose to highlight the importance of vaccination for people of all ages. We continue to support and encourage everyone to educate themselves, to talk to their healthcare providers about staying up to date on recommended vaccinations, as well as protect themselves and their communities from preventable diseases. Evidence continues to overwhelmingly support that vaccinations are a highly effective public health strategy that has prevented millions of deaths and illnesses. They also offer crucial protection even for those who are immunocompromised. During this month, individuals are encouraged to consult with their healthcare providers to ensure that they and their families are protected against preventable diseases by staying current with recommended vaccinations. Nevada has a network of health districts and contracted public health clinics found around the state, including the newest system, the Central Nevada Health District, which is a clinics location serving many of our rural communities, including Churchill, Eureka, Pershing, Mineral counties, as well as Crescent Valley City. We encourage you to consult with your local agency to learn more about vaccine schedules and opportunities to receive these vaccinations. Also, during our program manager update, NOMHE program officer Carlos Ramirez Gomez will discuss the office's recent success in connecting community with immunization resources. And then finally, additional observations I'd like to point out are just a few events that are happening throughout the month. So National Back to School Month, supported by related observations for Kids Eat Right Month, and Children's Eye Health and Safety Month. National Eye Exam Month, please remember to go and get your eye exams. National Minority Donor Awareness Day, August 1st. Last month, NOMHE hosted a Lunch and Learn with the Nevada Donor Network, so you'll hear more about that during the program manager's update. World Lung Cancer Day was August 1st. National Faith HIV and AIDS Awareness Day, so a topic addressed statewide by the Faith and Health Coalition as well. Here in Reno, by Access for Community and Cultural Education Programs and Training, ACCEPT, who I believe we have in the audience somewhere. In the women's health space, there's World Breast Cancer Research Day on August 19th, as well as National Breastfeeding Month this month. Medic Alert Awareness Month. As electronic medical records evolve, this observation serves as a reminder that in the field, every second matters, and medical alert bracelets can speak when patients can't, whether it's allergies, chronic conditions, or emergency contacts. These small tools give EMS providers critical information fast. National Road and Victim Month, as well as Traffic Awareness Month. So as NOMHE pivots its staffing resources to address the equitable considerations related to vulnerable road users, these observations serve as introduction to these related topics. And then finally, I'll end with the Happiness Happens Month and National Civility Month. And we'll point out that taking place concurrently with today's meeting is NOMHE's training for Northern Nevada Department of Health and Human Services personnel on workplace civility. So with that said, it is our practice here on the advisory committee to rotate reading of the land acknowledgements. With that said, our advisory committee member, Dr. Samuel Hickson, who is our vice chair, would you like to present the land acknowledgement today?
Thank you, Mr. Chair. For the record, Dr. Samuel Hickson, proceeding with the land acknowledgement with blessings. The Office of Minority Health and Equity, as a program of the Nevada Department of Human Services, acknowledges, honors, and respects the diverse indigenous peoples connected to this land and recognize the state of Nevada it is situated on, the traditional homelands of the Nuwu, Niwi, Numu, and Washishu. We offer gratitude for the land itself, for those who have stewarded it for generations, and for the opportunity to work alongside our tribal partners. We encourage everyone in this space to engage in acknowledgement and continue learning about the indigenous peoples who work and live on this land since time immemorial, and about the historical and present realities of colonialism.
Thank you, Vice Chair Hickson. Nick Dunkel once again for the record. With that said, we will move on to agenda item 3, which is public comments. So public comment will be taken during this agenda item. No action may be taken on a matter raised under this item until the matter is included on an agenda as an item on which action may be taken. The chair for the Advisory Committee on Minority Health and Equity will place a 2-minute time limit on the time individuals may address the committee. I will also elect to allow public comment on a specific agenda item when that item is being considered. To provide public comment telephonically, please dial 1-775-321-6111 anytime after I have announced the period of public comment. When prompted to provide the meeting ID, please enter 343-446-289 pound. I'm hearing or seeing none here in the room in terms of public comment. If you're here, you may use the microphone here at the podium. Morning, I believe. Just one quick second, Miss Taylor. I think we're working with the mic here. Just want to make sure everybody can hear you. All right, it looks like we have one public comment in the room.
Yes, I'm Gwen Taylor with Accept, and we've been in Reno since 1995. So we've been working with HIV prevention, and now we're doing specifically care with health education, risk reduction groups, now medical case management, medical transportation, minority AIDS initiative, and re-engagement in care. We've always done our services in Northern Nevada, but I find a need to go down to Las Vegas to work with our Black and brown people regarding health education, risk reduction. We've been very successful up here. We serve them dinner from 4:30 to 5, and then we have a person come in and talk, like Dr. Hickman or Dr. how you say it, Rach, or Dr. Dunkel. Anyway, we bring in guest speakers, pharmaceutical speakers, and there's such a need. And so I want to go down there in that 89106 zip code. Is that West Las Vegas? Or is that, there's West Las Vegas and there's another part of town. North Las Vegas, right? Okay, so we want to really concentrate on those zip codes, but everybody is welcome to come. But let me tell you something. I made a budget last year. I had no idea Las Vegas was huge. So if I got a person coming from Henderson to West Las Vegas, that's going to be about a $75 Uber ride. So I'm asking anybody that knows anybody rich or any casinos that have a heart for people with HIV and AIDS, because up here it's a hard nut to crack. I think down there you guys have more latitude and people are more open. So we're looking to get some matching grants to open up her Las Vegas. And we're looking we're gonna plan probably September to December and look at opening it up in January. We're either gonna have it at the Doolittle Center or we're gonna have it at Victory Baptist Church. But Angela, I ain't even talked to Victory Baptist Church yet. So hoping anybody on this call to go to Victory, because I ain't called the pastor yet. But years ago, Victory, when we started out in 95, Victory Baptist Church had an HIV/AIDS prevention program. So we just have a heart for the people. Now, when I say we're going to target Black and brown, BIPOC people, we also let white people come. Don't get me wrong, I'm not prejudiced. So, but there's just a need for our brothers and sisters to get together, have dinner, and get educated. So please keep that in mind. If you know any donors that would help us, I'm trying to, hopefully the state gonna give me $130. That's $130,000. That's what we had last year, but this year it might be different. So anyway, I'll let you guys know once we do the budget. Miss Tina, I'll let you know what's going on. And we really want to do her Las Vegas, health education, risk reduction. We know there's a lot of agencies down there. Is my 2 minutes up? But we are the only Black-led agency in the whole entire state of Nevada receiving Ryan White funding. The only one. So I emphasize that because other people can do the work you do, but then sometimes you need the people that look like you to do the work you do. So thank you for this comment. And Tina, I want to applaud you for a wonderful job, child. You are an asset to this state, and I applaud you so much. Same with Bishop Bonnie. She's been in the fight forever. Same with all you people. People, you know, you guys have a passion for people, and you love folks. And I appreciate y'all. I'm just getting goosebumps up in here. I'm also a preacher, but I ain't gonna preach today. But I want to end with this. I was very depressed about 2 weeks ago. I suffered with post-traumatic stress disorder because I had 3 murders in my family, all on Friday the 13th, different years. I was feeling sorry for myself when I was getting dressed, and I just want to die, Lord. And you know what? I hope y'all don't mind me saying Lord. If you don't like the Lord, I probably was talking to Buddha. Anyway, long story short, I said, I'm tired, Jesus. And I don't know if it was Jesus spoke to me or whether it was Gwen that spoke to me, but he said there's victory in your DNA. And I want to let everybody know that's out there that might be depressed or might be down. And when I asked, I said, I love acronyms. So the D is for divine, the N is for nourishing, and the A is for awesome. So whoever you believe in, know that there is victory in your DNA.
Thank you so much, Ms. Gwen Taylor, for your public comment. I believe we have a hand raised. Bishop Bonnie Radden, just a quick reminder, no action may be taken on public comment, but I do want to acknowledge that your hand is raised.
Appreciate that. Bishop Bonnie Radden, for the record, I just want to say, Gwen, if you call me, we can help connect you with the right folks here who may not be in that direct place, but I have some ideas.
Thank you so much, Bishop Bonnie Radden. I believe we also may have had another public comments online. Alex, could you confirm?
At this time, Chair, no one has their hand raised. However, we do have one person that is joined by phone. If that person would like to speak, you can press *6 on your phone keypad to unmute. Okay. It seems that no one online has unmuted or raised their hands. However, there's additional person in the room.
Please proceed for your public comment.
Good Good morning. My name is LaWanda Jones. I'm the opioid prevention coordinator for the Department of Native American Affairs, and we're on the boarding school campus in Carson City, Nevada. And I just wanted to tell you a little bit about my program. We work and try to supplement the opioid programs within the 28 tribes within the state of Nevada. So we work with them quite closely, and we're doing a tabling event August 29th. It's with the Washoe tribe. They're coming out to Stewart, and they're going to have an event out there. So we're going to provide fentanyl testing strips and Narcan, naloxone, that kind of thing. So I just wanted to make whoever aware of all that. Department of Native American Affairs. Yes. Thank you.
Thank you so much for your public comment. It looks like we have another public comment here in the room as well.
Yeah, thank you so much. My name is Mario de la Rosa. I am with Latino Art and Culture. And next month, we are celebrating Hispanic Heritage Month from September 15 to October 15. And we are organizing for the 10th year the Fiesta on Wells on September 21st on South Wells Avenue. And you are invited to come, have fun, to contact the Latino community. And we are going to have around 80 booths with information about community services, entertainment for children, health, education, and other booths. If you need, you would like to have a booth in our location, in our festival, please call me, 775-378-7025. Thank you. Thank you so much.
Thank you so much for your public comment. Do we have any more public comments? Looks like none online. Any others in the room? Thank you so much.
Chair, if I can ask a question. This is Reverend Dr. Deborah Whitlock-Lax for the record. Sir, you said your phone number quite fast. Would you mind saying it one more time, but a little bit slower for me?
Yes, 775-378-7025. I apologize.
Thank you, sir.
Thank you so much. And Alex, it looks like you have potentially a public comment online.
Yes, Chair. Jane Rovianek, I apologize if I pronounced your last name wrong. If you could please come on, unmute yourself and then speak.
Thank you so much. I appreciate the opportunity to present. My name is Jane Rovianek, and I am with an organization called Foster Kinship. We are an organization that supports relatives that are caring for children that cannot remain in their home with their parents. We are having a conference coming up on September 5th. And this particular conference is going to be able to support not only caregivers, but also professionals in the child welfare field. So we invite, it's going to be held at our, in Las Vegas. And we have information for those that are interested in more information. Obviously, they can get online for our website, fosterkinship.org. Appreciate the opportunity.
Thank you so much for your public comment. Seeing no others in the room, Alex, do we have?
No, Chair, there are no other hands raised or individuals unmuted at this time to provide public comment on the virtual.
Thank you so much. Thank you all for your public comments, both online and in person. It looks like there's a lot of great work being done. Thank you for taking the time to share all of that with us. With that said, members, you were provided a copy of the June 4th, 2025 draft minutes, and they have been posted on NOMHE's website online as required by statute. So with that said, we'd like to move on to our fourth agenda item, which is review and approval of the June 4th, 2025 Advisory Committee meeting minutes. Thank you to NOMHE staff for providing these. Have we all had a chance to take a look at these? And with that said, may I ask for any changes or a motion to approve?
For the record, Mr. Chair, this is Dr. Samuel Hickson. I do have a correction that needs to be done on page 2, number 4, bullet point, what looks like 4. My name is actually spelled incorrectly, so if we could reduce the second M to only one M, that would be greatly appreciated.
Nick Dunkel, once again for the record. Thank you so much, Vice Chair Hickson, for providing that that comment. For NOMHE staff on the call, please note the desired change. Are there any other desired changes for the meeting minutes for the last June 4th meeting? With that said, may I ask for a motion to approve the meeting minutes from June 4th, 2025?
This is Bishop Bonnie Radden for the record. I say let's go ahead, do it. Yes.
Deborah
Approve the
Lax,
minutes.
for the record, I second.
Thank you so much, Bishop Bonnie Radden and Reverend Dr. Deborah Whitlock Lax for the motion and the second as well. Is there any discussion that we'd like to have ahead of moving for a vote?
Reverend Dr. Deborah Whitlock Lax, no discussion, but let's just truncate my name to P. Debs for the record.
Thank you so much, Reverend P. Debs, for making that aware. With that said, I'd like to call for a vote for the meeting minutes for June 4th, 2025. All in favor, please say aye.
Aye.
All opposed, please. All opposed, please say nay. Thank you so much. Motion carries. All right, and in addition to the new streamlined format for the meeting minutes, now that they've been approved, a link to the full recording for the February 11th meeting will be added to the NOMHE website to augment the written minutes. Next, we turn our attention to agenda item number 5, which serves rather to inform the advisory committee members of NOMHE's sustainability status. With that said, Program Manager Ms. Dortch, would you proceed?
Thank you, Mr. Chair. This is Tina Dortch for the record. I just wanted to make one point of correction, if I could, Mr. Chair. We have taken upon ourselves a streamlined minute-making protocol. However, the new recorded access will become effective with our June meeting, not with the February. So beginning with our June 4th meeting going forward, if you would like to see more details related to the contents and the conversations of these meetings, and the minutes do not give you that, the recording of the meeting itself will be available starting with June. And thank you for that, allowing me to make that clarification, Mr. Chair. So we are at an agenda item that is very important. All members of our advisory committee should have received the bylaws. We do make sure we circulate these at least once a year. They are also available on the NOMHE website so the public can review them as well. It's important that whether you are a returning advisory committee member or a new person who's been appointed, that you're aware of our bylaws and how we conduct our meetings. Today, I'm just going to focus on the sections that have a direct implication for our advisory committee members. And Mr. Chair, I'm going to begin with the section of the bylaws that talks about member duties. And because this is statute, if you will please indulge me, I'm going to read these verbatim so there's no misinterpretation. The first point that I want to make available for everyone to take into account is that this particular body will advise the manager on all matters concerning the manner in which the purposes of the office are being carried out. And number 2, this body will review the manner in which the office uses any gifts, any grants, any donations, or appropriations to carry out the purposes of the office and make recommendations that they then review any reports that are submitted to the manager, including and without limitation, the report that's required per statute 232479, and then make any recommendations regarding those reports. That one statute I just mentioned in number 3 has to do with our biennium report. But you will, for example, Mr. Chair and members on the November agenda, see a diversity inclusion liaison annual report. We will be sharing that with this body. It is an initiative that NOMHE teams along with the Governor's Office for New Americans and the Nevada Commission on Minority Affairs to support. So we look forward to sharing that with this body. And those are the three major components that make up the duties of a member of this advisory committee. Secondly, I want to make sure that you are aware as an advisory committee member, you do have some benefits. Per statute 232483, those benefits are in the form of salary, covering of expenses, and for members who are holding public office or employed by the government, you do have some leniency that is afforded you so that you can serve on this body. Number one, to the extent that money is available for that purpose, each member of the advisory committee who is not an officer or an employee of the state of Nevada is entitled to receive a salary of not more than $80 per day, as fixed by the manager in consultation with this committee for each day or portion of a day spent on the business of this committee. Each member of the advisory committee who is an officer or employee of the state of Nevada serves without additional compensation. To the extent that money is available for that purpose, each member of this committee is entitled to receive the per diem allowance and travel expenses provided for state officers and employees in general. A claim for this payment is pursuant to this section and must be made on a voucher approved by the manager and will be paid as other claims are paid by the state. So what that means in layman's terms, Mr. Chair, is that if you are interested in getting that $80 remuneration, it's as simple as letting me know in a direct email that you would like to take advantage of this, as it is your right. Number two, each member of the advisory committee who is an officer or an employee of the state of Nevada or a local government must be relieved from his or her duties without loss of regular compensation, so that he or she may prepare for and attend these meetings and to perform any work necessary to carry out the other duties of this advisory committee in the most timely manner practicable. A state agency or local governmental entity may not require an employee who is a member of this committee to make up that time or to take vacation or use compensatory time to serve. And if they happen to be absent, that they will be given leniency in replacing and making and catching up on the work that they may have missed as a result of service. Mr. Chair, that does conclude my overview of the bylaws. And again, this committee does have the full set of bylaws at their disposal.
Nick Dunkel, once again for the record, thank you so much, Program Manager Ms. Dorch, for the refresher on our bylaws. Looks like they were last amended in 2023. With that said, I'd like to ask any of the advisory committee members if we'd like to revisit any of the sections of the bylaws for revision. If so, we would need you to identify the article number and state your proposed revision. Would any of the advisory committee members like to revisit any sections? Seeing none at the moment. Okay, it looks like we don't have any revisions or we'd like to revisit any sections at the moment. With that said, I'd like to call for a motion to keep the bylaws with no modification. With that said, would somebody like to make a motion?
This is Dr. Samuel Hickson for the record. I motion to keep the current bylaws as they are in existence.
Thank you so much, Vice Chair Hickson. Do we hear a second?
This is Nancy Bowen. I second the motion.
Thank you so much, Nancy, for providing the second there. Is there any discussion that we would like to have before moving to a vote? Hearing or seeing none. With that said, all in favor, please say aye.
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 All opposed, please say nay. Hearing or seeing no opposition, the motion carries. Next, we turn our attention to agenda item number 6, our annual election for chair and vice chair positions on the advisory committee. This process is facilitated by our program manager, Ms. Dorch. Please proceed.
Thank you again, Mr. Chair. Tina Dorch for the record. This will be the second and last part of our board business that we handle once a year. As part of this agenda item, we're going to allow for chair and vice chair nomination processes to be completed. And we do this individually, meaning that we first identify who our chair will be, and then we identify who our vice chair will be, and then we complete the process with one joint motion. So please also be advised that we do this in an open process. And what that means is that your nominations will be shared publicly. We will use, if necessary, a roll call process, and you will be required to say your preference for a person to serve as our chair or our vice chair. And with that bit of instruction, Mr. Chair, I will proceed with the election of chair. At this time, do we have anyone who would like to either self-nominate or make a nomination / recommendation for someone to serve as our chair for the next 12 months?
This is Dr. Samuel Hickson for the record. I would like to personally nominate our current chair, Mr. Nicholas Dunkel, to continue in his position as chair due to his extraordinary leadership that we have had and experienced since. So I put forth nomination for Mr. Nicholas Dunkel.
Wonderful. Thank you for that, Dr. Hickson. And Alex, please help me because I can't see what's happening in the room, but are there any other calls for nominations or self-nominations for the position of chair?
Program Manager Dortch, at this time, none of the advisory committee members in person in Reno has signified that they would like to nominate anyone else.
And I believe we have folks who are joining virtually. There's no activity in the chat or by other means, correct?
Program Manager Dortch, at this time, I do not see any hands, unmuting, or anything from the 3 advisory committee members online.
Very good. Thank you, Ms. Neal. Then the only question remaining at this point is, Mr. Dunkel, do you accept the recommendation for you to continue as chair?
Nick Dunkel, for the record, I accept the nomination with gratitude. Thank you so much.
Very good. Then we will now move on. That particular slate is closed. We'll move on and repeat the process, asking if there are any recommendations or self-nominations for the position of vice chair.
Nick Dunkel, once again, for the record, I would like to nominate our current vice chair, Dr. Hickson, for his continued leadership and support of this advisory council.
Thank you for that. Ms. Neal, are there any other indications that someone would be interested in assuming the position of vice chair for the next 12 months?
Program Manager Dortch, at this time, none of the advisory committee members in person are signifying that they would like to submit another nomination. Additionally, none of the advisory committee members online are signifying via a virtual hand raise, unmuting, or their video that they would like to submit a nomination.
Well, very good. This was a very tidy process. And because we have completed our slate, all that will be left for this process to conclude is a motion to recognize our current chair and our current vice chair extending their tenure for another 12 months. Do we have anyone willing to make that motion?
This is P. Debs for the record. I so move the motion for both the current president and vice president to remain in office.
And I will just add, this is Tina for the record, I'll just add for a slight modification to the motion that we are going to put them in positions of chair and vice chair. Same intention.
Yes.
But we can call for the vote now. If we could have by a show of, I would say sounds off, aye or nay. All those in favor say aye.
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 Any dissension, say nay. Very good. Again, tidy work was made of that process. We have our chair and vice chair who will retain their positions and be our vice chair and chair going into the next 12 months. Thank you very much. Mr. Chair, I turn the agenda back to you.
Thank you so much, Ms. Dorch. At this time, I'd like to give the opportunity to our Vice Chair for any potential remarks.
Thank you, Chair. For the record, this is Dr. Samuel Hickson, and I just would like to say that it has been an honor to serve on this committee and continue to serve on this committee. The work that we do for Nevada is extraordinary, and I do believe that we are one people, one state, and live by the model that we are one Nevada. I think this advisory committee serves not just for the North or for the South, but for the betterment of all people. And Mr. Chair, I must say that under your direction, under your leadership, we have really taken to heart what we stand for and what we do. So I appreciate your leadership and what you have done for this committee. But to my fellow committee members, I also appreciate the opportunity to serve alongside you for as long as I have and continue to serve as long as I am able to do so. Thank you.
Thank you so much, Dr. Hickson. You are a tough act to follow, but I will try to follow up with some remarks of my own. Thank you so much for the nomination. And as you mentioned, I think following and working with this community, the immense work that Ms. Dorch and Carlos, Alex, Karina, all of the folks that work with NOMHE is incredible. Watching the work that you do and seeing the impact that it has on communities is an immense pleasure for me, and I can't thank you all enough for allowing me to be part of this process as we continue this work. To my Vice Chair, thank you so much for your kind words. I completely recognize your impact as well for serving on this committee as long as you have, and for continuing the work that you do. For our advisory committee members, both new and continuing, I appreciate your work also. The collaboration that we do, the compassion that we have sitting on this committee and working for the betterment of health and reduction of health disparities for our minority communities in the state. I think you said it best, Vice Chair Hickson, when we're talking about being one community, one Nevada, and working towards the health of our communities, both whether it be urban communities, rural communities, and all the way across the state. The work that NOMHE does is incredible, and I consider it an immense pleasure to continue this work here. Thank you so much. With that said, we will go ahead and jump onto our 7th agenda item. This is for information and discussion only. This is the presentation of the NOMHE budget. With that said, I'd like to turn the agenda back over to our program manager, Ms. Dorch.
Thank you, Mr. Chair. Tina Dorch for the record. And just to bookend the statements about our advisory committee, it goes without saying that the staff appreciates your work. So many of you have contributed so much, and that we have to have you. It is a symbiotic relationship that keeps the office viable. It allows us to have a level of subject matter expertise that we would not have otherwise. And I can't say it enough that I sit on other statutorily required advisory committees, Mr. Chair and Vice Chair, and very often it's very difficult to get quorum, and it's even more difficult to have someone voluntarily serve as chair and vice chair. So we, in my almost 8 years with this position, really don't have that problem, and I think that says a lot. So thank you very much. And moving into agenda item 7, this is also a very important component of our meeting. It is, I like to say, the break between our required public-facing, transparent activities and sharing of our status of our office before we get into the more exciting work that we're doing when we talk about our outreach and our impacts. But again, even talking about our budget, it's very important and we take it very seriously. So thank you for the opportunity to share this informational item. And as you alluded to, Mr. Chair, we do this because it's a way for our advisory committee members to understand our sustainability, for the public to understand how we're able to carry out our purpose. And in cases where we don't carry out our purpose, there's a reason for that as well. So moving into the report, thank you for my little build up to this. Today's report is reconciled through June 25th of this year. And Be aware that our state's fiscal year, it ended in June, on June 30th of this year. However, given the production date of this report, it really does fall in that period that we call the mid-year-end reconciliation. And so full reconciliation is not concluded until the end of August, August 29th to be exact. So the report that you see in front of you today, there's some fluidity that's to be expected, and it is not yet finalized, but we're able to at least, again, share a snapshot with everyone today. Moving along, our revenue source, every quarter, for transparency's sake, we share with the community the update to our revenue sources. And at some point in time, it does include grant activity. However, at this point, we are not holding or directly receiving any grant dollars. So the totality of our funding is from state appropriated tobacco settlement monies. For those who don't know, that's also called the Funds for a Healthy Nevada, or FHN dollars. As I mentioned, the funding period, for those who don't follow the state that closely, it is a 12-month period, and our fiscal year runs from July 1 to June 30th. And NOMHE's current award of $327,918 for our fiscal year, it's split between $109,152 for FTE personnel, plus $218,766 for operating expenses. And it's within those operating expenses where we find and we reflect the cost to retain NOMHE's 3 contractual employees. As I mentioned, while this report is reconciled through June 25th, the $315,647 of total expended monies, that does not reflect all the pending transactions, as we are still working through the year-end process. This period that ends for June 30th, this is just before, again, we conclude all that wrap-up activity, and serves as a snapshot. So that $12,270 you see as today's, or as the current balance as of the reporting of this report, that is going to be revised. But that is a reflection that there are remaining transactions to be reviewed, such as personnel related expenses and transfers between budget authorities. And then the $568.26, that is a reflection of the current fiscal year, state fiscal year 2026, which ends June 30th of 2026. And again, because we have not reconciled, we have to be very mindful that that dollar amount, that $568, does not reflect the uploading or the application of all of our operational expenses. So I would prepare this body to realize that that dollar amount will increase, but likewise, the projected year-end balance, that amount will decrease as we're only in the second year of the current fiscal year, the second month of the current fiscal year. I'd like to end by just saying, reminding everyone that if we were to look at past trends, that NOMHE is a very good steward of our modest budget, and that we ended last session or last fiscal year with a $700 balance, which is a very, very good outcome based on the amount of our budget. To have only $700 unobligated is a very good telling sign. Mr. Chair, with that, I conclude my report. And if you have any questions, I'd be happy to answer them.
Dunkel, once again, for the record, thank you, Program Manager Ms. Dorsch, for sharing that update. Do we have any questions or comments from the advisory committee members at this time?
Thank you, Mr. Chair. This is Dr. Samuel Hickson for the record. Program Manager George, I just have a quick question. You mentioned that you are not currently holding or receiving any grant funds, but are you barred from receiving or applying for grants that may not come from the state? And I only ask because, as I think you are painfully aware, and as this committee has made you painfully aware, this budget compared to what you have to do within the community is abysmal. And as we talked about in the networking breakfast this morning, there's a lot of health needs that need to be done in a not just food desert, but a resource desert. Yet there are mountains of organizations that can provide funding. So my question is, are you barred from receiving funding that doesn't come from the state of Nevada?
Mr. Vice Chair, thank you so much for the question. And there was a sort of moratorium on NOMHE's actively pursuing grant activity. But as far as our partner opportunities at the state level, through the community activities and our partnerships, such as those that were cultivated this morning, we absolutely are interested in looking for opportunities. And one of the things I think that we can offer to our community-based partners, Mr. Vice Chair, is that oftentimes dollars require having a municipal partner, someone to be that anchor to the activities, and we can serve that function. We are in a position where we would need to have administrative dollars that come along with these things. Unfortunately, Mr. Vice Chair, as you can imagine, our staff is not growing, it's getting smaller. And in order to be a good and viable partner on a grant, we would have to be able to probably hire, and that means administrative dollars would have to be a part of the funding stream. But our shingle is out, especially when it comes to community partner-based grant activities, Mr. Vice Chair.
Thank you very much. And as a follow-up question to that, Program Manager Dortch, is there a reason that there is a moratorium on you being able to receive grants?
Well, the moratorium is very informal. So I'm glad you asked the question, because as soon as I said it out loud, I didn't want it to sound like an official edict. It is something that we've done just until we kind of understand the funding strategies and the funding priorities at the federal level. There is no secret that we have had in the past dollars that have been obligated, that we have been literally in the middle of delivering the outcomes on, and they've been de-obligated. March was an example of that. Many of the former Department of Health and Human Services, now Human Services, we lost several staff people because existing dollars that had been appropriated were recalled, were de-obligated. So it is an informal pause that it takes a lot of effort to go after, especially federal level grants, and to make sure that we're aligning with priorities and don't run the risk of having them de-obligated. We're just waiting to see when those priorities become much clearer, and then we can proceed.
Thank you.
Nick Dunkel, once again, for the record. Thank you so much, Ms. Dortch, for that eloquent explanation and answering of questions by the advisory committee. With that being said, would any of the other advisory committee members have any comments, questions?
PDEPS for the record. Question, is this report replacing the spreadsheet that we normally use? Let me commend you, Tina, and staff for taking the complexity out of reporting and making it an executive report that everyone can understand. Really appreciate that leadership.
Tina Dortch for the record, and thank you, PDEPS, for that comment and for the observation. It was a decision that was made alongside the decision to create a more streamlined minute-making process. Again, the level of detail is available should anyone want it, but if for those who recall, it can be a little convoluted. And we try to, following our class standards as an equity-based agency, to make sure that no matter someone's comprehension level, that they can follow along with this. And again, it does serve for transparency purposes. So thank you for the observation.
Thank you so much, Ms. Dortch. Nick Dunkel for the record. I wanted to also thank you for that. And I don't like to speak for all of our advisory committee members, but I think this is one of the things that I can speak for us on. The streamlining of the process is incredibly helpful, and we thank you so much for taking the time to do so. With that said, I believe advisory committee member Tiara Flynn is online and does have a question or comment. Ms. Flynn, please proceed.
Yes, thank you, Tiara Flynn, for the record. Just going back to the community partner like grant opportunity, Ms. Dorch, is there anything that we can do specifically as advisory members, other than like putting you in contact with people that have opportunities?
Yes, thank you for the question. This is Tina Dorch. We have a strategic plan, Ms. Flynn, and we try to not just simply chase the dollars. In today's world, it's very tempting to chase the dollars, but we try to make sure that it's mission driven and that it does address our strategic aims. Um, but conversations like our morning breakfast with our Northern Nevada partners, and if you remember the call to action for those who were there, it's very intentional. We ask that you look for opportunities to partner that align with your mission and purposes. But again, we feel that we can come alongside in many cases, but there are some areas that don't make sense, air quotes, for NOMHE to become involved in, especially if it is something that does not come with administrative dollars, because we do have a small staff.
Thank you so much, Ms. Dorch, for that explanation. Ms. Flynn, I just see you nodding. Did you have any other comments? Awesome. Thank you so much. With that said, I believe Angie Wilson has a comment or question as well.
Angie Wilson for the record. I just want to say, Director Dorch, I genuinely appreciate the work happening from you and your staff. I think I was vocal at our last meeting in regards to the serious underfunding, in my opinion, and the work that's really necessary if we're really talking about, you know, equity in minority health and in these communities. I think that the one thing that's alarming is what's happening at the federal level. I certainly can appreciate the concerns happening there. But I just would say that the advocacy for minority health has got to continue to be strong. And that will always be my position as we move forward. I feel even more concerned about it giving, you know, the outcomes that will come from the one big beautiful bill impact in the loss of healthcare and resources in these communities that are really needing support. With the fear that comes with what we're seeing happening in these communities as well. And that's alarming to me as an Indigenous person in these communities. I just want to commend you and your staff. I know it's not got to be an easy time, but I would say that's true for a lot of us sitting here today. And I think it's important for us to continue to be a voice and continue to be stewards of health advocacy in these communities during this trying times. And I would just say that resilience isn't just something, it's not just a word. It's something that I can attest that our tribal communities have gone through since time immemorial. And I would just say that it's no different in this environment today. And we'll get through these times that are difficult for a lot of the people that we represent here. But I want to commend you and your staff for doing an incredible job with very little resources. And I can tell you, as a tribal health director, we certainly can acknowledge and feel the pain of being underfunded, rubbing two nickels together to make magic happen. But you and your team have done a great job. I just want to commend you.
This is Tina Dorch for the record. Thank you so much. Director Wilson, as a frontline resource provider, service provider, you know better than most how important this work is. And just a throwback to one of my other statements is we are so very fortunate to have the type of expertise represented across that head table. And resilience, that was a word I was going to use as you were talking. I think that we don't give up, we just regroup. And we will make sure that for communities that are marginalized, that we are able to amplify the work of others and to make available to individuals who perhaps have been underserved in the past, that they're aware of these things. And not to get too far off topic, but we look forward to our November agenda because we are going to be talking about here at the state level a major change here within the Department of Health and Human Services, which is now the Department of Human Services. We will have a presentation on that reorganization and the creation of the new Nevada Health Authority and where NOMHE falls into that and how we're going to be maintain our role as amplifier and convener and do it in ways that are meaningful and measurable. So thank you to everyone for your comments. And yes, we have a modest budget. And it's amazing how we get things done. And I'm really excited about the last half of our agenda because this is really where we are able to demonstrate impact. I always say the first part of our agenda is the business. And then this is where we can really talk about, how we put our good faiths to work.
Thank you so much, Ms. Dorich, advisory committee members, for your comments and questions. I do believe we have another one online as well. Bishop Bonnie Radden, please proceed.
Thank you so much, Chair Dunkel. This is Bishop Bonnie Radden for the record. I just want to bring up a couple of things in this space, as we know that it's been incredibly challenging. And I want to make this statement that there's common unity in community. Common unity in community. Ms. Dorch, has there been an idea, and I will share what I mean when I come out of this space, an idea for a brainstorming session with our committee members and maybe some community members around funding streams, funding opportunities, because I don't know the laws. What I do know is that recently I've been involved in a huge plan and a huge space of faith and health equity. And the funding stream that's coming from there, from larger nonprofit healthcare organizations like, I'll put the name out there because it's somebody, a multi-billion-dollar healthcare organization called Advocate Health that we just did an MOU with who I'm working with in behavioral health. And so I'm just wondering, and going back to my question, has there been a thought to have a brainstorming session with our committee members and community members around this topic that we're talking about? That's my first question. I don't know if you want to answer it before my second question.
Thank you for that, Tina Dorch, for the record. There is no formal initiative that would convene our advisory committee members and community partners, but I think that has merit. And I think that there's some logistical things that would have to be worked out when it comes to open meeting law protocols and things like that. But that does not deter us. We are not afraid of open meeting law protocols. So I would be open to that. I would be open. So short answer is I think we would be open to that, Bishop.
Bishop Bonnie, for the record again, I would be willing to have a phone call with you to see how we could possibly do that, and I'll put that in my agenda. Thank you. My second question is, as we see this, and maybe you're going to talk about this, maybe I'm jumping the report, but I see the tobacco settlement funds, and we all know that those are soon to run out. Is there the space where the opioid settlement dollars, if you will, I don't know what exactly they call that's going to be a part of the budget or be afforded to NOMHE, if you will, in the near future?
Thank you for the question, Tina Dorch, for the record. Very astute of you. None of these settlement dollars are infinite, correct? It has a finite date to it. And it feels like it's been around for quite some time, and it is, on the lower end of the trajectory. We, during this last legislative session, attempted to go after and make application for opioid settlement dollars for a position. But quite a few agencies did the same thing. Everybody has their eyes set on the opioid settlement resources right now. It's not to say that we won't be successful going forward, but that does have upwards of 12 years, perhaps a little bit longer of lifeline to it. So it is an option for us to explore. But what I have to really end this conversation with is that we have always been told as an agency, as a program, before I was program manager, that we have to be grant focused. We cannot continue to survive solely on settlement dollars, that we have to be diversified. And I agree with that. I think it behooves us to be diversified in our funding streams. But right now we are, as you saw in my report, leaning completely on our funds for Healthy Nevada dollars. Those do have a shelf life, and we are obviously looking at ACRN and FRN for opioid dollars and additional grant dollars.
Bishop Bonnie Redden again for the record. I guess the brainstorming session timing is now.
Yes.
Thank you. Thank you for this opportunity.
Thank you so much for the comments and questions, Bishop Bonnie Radden, as well as for that clarification, Ms. Storch. With that said, we do have a couple other questions up here from the advisory committee. With that said, please proceed.
Maggie Salas Crespo for the record. Tina, I had a question about the budget because this is the one for the fiscal year that just wrapped up, and I know there was restructuring. Did they change your budget account? And that's one question, or do you still manage and have your own budget account? And did you get funding for similar levels? I know they usually adjust for cost of living for personnel, but just wondering what your new funding looks like.
Thank you for the question. And if you look at the the third bolded section down, that is our current operating budget. And that is the complete dollar amount that represents our budget. And it has been basically stable. That is, we didn't lose money, which honestly, I'm very grateful for in our current environment. But it did not reflect any increases. And our budget authority has not changed. Our budget account has not changed. Our budget authority has not changed. We're still a program of the director's office, and we are found within the director's office budget as a line item.
Thank you so much. Any other comments or questions from the advisory committee? Hearing or seeing none. Ms. Dorch, NOMHE staff, I just wanted to also commend you before we move to the next agenda item. I think one of the themes that we're seeing with a lot of the comments made, questions, as well as just kind of uncertainty. I addressed this morning in terms of the uncertainty that a lot of the folks that we serve are experiencing, and I think that this is something that's also happening with a lot of funding sources. Just kind of moving forward as well. And I just wanted to commend you, your staff, for working and not only surviving, but thriving in that uncertainty and providing the services that you do. So ahead of moving on, I just wanted to commend you for that and say thank you. With that said, we will go ahead and jump on to our next agenda item here. Ms. Dorch, this is also going to be for you as well. So this is a report on NOMHE activities, initiatives, and impacts.
Thank you, Mr. Chair, Tina Dorch for the record. And I promise everyone I will stop talking so much very soon. We've tried to restructure the way we present our materials so that it's engaging and I get to showcase my amazing staff as well. But before I turn my attention to our NOMHE staff, and in lieu of a formal presentation, I'd like to share something that's time sensitive that I don't feel I can wait, obviously, until our November meeting to share. And that is a reminder that NOMHE is one of the 3 appointing authorities that identifies 6 of the 17 people who serve on the state's Advisory Committee for a Resilient Nevada, or ACRN. And for those that don't know, this is the body that's tasked to support the state's distribution of its opioid settlement monies, right? We were intentionally identified as one of the 3 appointing authorities so that we would have the equity lens and to make sure that those of the 17 persons, that there would be people representing certain profiles from across the community. And participation on this committee, it's really a unique opportunity to assist the Department of Human Services, formerly DHHS, to address our state's opioid crisis. The ACRN community members, they're asked to provide practical knowledge, to bring their lived experience, to share community observations, and then to also apply their professional skills in regularly scheduled meetings. And it's not overly cumbersome. I believe it's 2 meetings a year. Members are participating in the creation of ongoing reviews for the statewide needs assessment and the strategic plan, both that are required when you are recipients to opioid settlement dollars. And they're also to aid in the development of prevention and outreach campaigns, harm reduction programming, treatment options, and recovery support throughout the state. So to Ms. Taylor, I do say if you've not looked into ACRN dollars, you absolutely should, just because I know there's a crosswalk between some of our communities that we serve. And I think that you might have a very strong intersectoral case to make if you were to look at ACRN dollars. But for today, I just wanted to point out that of the 6 positions that NOMHE has to fill, the profiles are as follows. 1 person has to reside in Clark County and have experience having substance use disorder or have a family member who has a substance use disorder. The 2nd position has to be a person who has knowledge, skills, and experience in public health. The 3rd position has to be a person who is the director of an agency which provides child welfare services or his or her designee. Another person should represent programming that specializes in the prevention of substance misuse by youth. Another person should represent faith-based organizations and should specialize in recovery and substance use disorders. And then the final position that we have to recruit for is a person who represents a program for substance use disorders that is operated by a nonprofit organization and certified by the state. You can see on the next slide, Alex, that there is a place to submit a letter of interest in your resume. You can do that at any time, but later this week, NOMHE is going to be releasing an e-blast to our listserv that says the formal protocols for applying for these 6 positions. The deadline will be August 27th to do so. So please be on the lookout. As it says there at the very bottom of the screen, if you have not joined NOMHE's listserv, just make sure you have signed in today. I think Carlos is managing our sign-in sheet. Or you can just, if you are a virtual attendee, place your information, mention that you have an interest in ACRN in the chat, and we'll make sure you get on the virtual, on the distribution list to get that information. So just wanted to say that because again, that is timely. That's going to be happening later this week. It's relevant. We just are really hopeful that our community, that the folks who support NOMHE, that we can reach well within your rank and file and find persons to serve on that body. Having said that, Mr. Chair, I'm going to now turn the presentation over to Carlos Ramirez Gomez, and we can talk about some amazing work that the team has done.
One quick second. Nick Dunkel for the record. Just because I'm seeing a hand raise here in the audience, I know that we are serving as advisory committee members and reviewing the information. If folks have questions or points of interest, would reaching out to this email or to Carlos yourself, what would be the best route to gain more information on this?
2 ways to do so. At any point in the year, you can submit a letter of interest and a resume to the Funds for Resilient Nevada. That is the agency that operates and facilitates the ACRN. And the email address is frn@dhs.nv.gov. But likewise, NOMHE is going to be doing a more focused recruitment for those 6 positions, those 6 seats. And if you want to get that e-blast, that be on our listserv, just to make sure you either A, sign in the back, because you'll be added to our listserv, or B, if you're virtual, to just drop in the chat box that you're interested in being considered for one of the NOMHE positions on ACRN, and we'll make sure you get the information that's going to go out later this week.
Thank you so much, Ms. Dorch. One other point of clarification, Nick Dunkel again for the record. You listed a few different positions there, and I noticed that one of them needed to reside in Clark County. For the requirements for the other positions, are these positions that folks can apply for should they not reside in Clark County? Is that the only one with that requirement?
Yes, Mr. Chair. And Alex, if you go back one slide just to have all 6 bullets, there's only, I think, one that is specific. You must be a Clark County resident. But for example, looking at the second bullet, this could be someone from anywhere in the state. The only requirement is that you have knowledge, skills, and experience in public health. That's very all-encompassing. So yes, if you look at those 6 bullets, those are the profiles for which NOMHE will identify and make appointments.
Thank you so much, Ms. Dorch, for the clarification and for the great information here. With that said, my apologies, Carlos. I'd like to turn it back over to you for your presentation.
Is the mic on? Oh, okay, good. All right. Sorry, everybody. All for the record, my name is Carlos Ramirez Gomez. I'm a program officer with the Office of Minority Health and Equity. I'm sorry, everybody. I think my voice is going away, but I'm going to try to go through the whole presentation. My presentation today is on community outreach and engagement. So good afternoon, everyone. Thank you for sticking until my presentation. First, I wanted to say how glad I am to be here with you today. So when we think about a strong community, it's not just about building parks, right? It's about people. It's about our neighbors showing up for each other, listening to one another, and organizations working together so that everyone has a fair chance at a healthy, fulfilling life. So let that sink in, please. That's really what community outreach and engagement are all about. And today, I want to share how we've been putting that into action, the lessons that we've learned, the events we've hosted, and the impact that we've made together. Next slide, please. So there are a few foundations for successful outreach. Over time, we've learned that there's a few key principles that make community engagement truly work. So I want to take a moment to walk through them. First one I have on the slide is trust and relationships. Trust isn't built in a single meeting. It's built by showing up again and again and listening with respect. People need to know we're not just here to talk. We're here to listen and follow through. Second on the slide is cultural respect. Every neighborhood has its own history, values, and traditions. We approach every community with humility, not assuming we know best, but willing to learn. The third one is having clear goals. When we show up, we're honest about why we're there, what we hope to achieve, and how it will benefit the people that we are working with. The fourth one is inclusive communication. We use plain language. For example, in this presentation, I'm using very simple language so that everyone in the public can understand me. We translate materials. Sometimes we partner with organizations that help us translate those materials. For example, today we have an ASL interpreter so that we can reach the people, everybody. And we work with trusted community voices, people who already have a connection with the community. Number 5, authentic partnerships. We share decision-making with local leaders and organizations. And this isn't about telling people what's best, it's about working side by side. The 6th is accessibility. We hold events at times and places that work for people. We think about transportation, childcare, disability access, all the things that remove barriers. For example, at an event last year, one of the barriers for the public coming to my event was having childcare. So I contacted someone that would provide pro bono childcare, and people came. The 7, being consistent and following through. So if we promise something, we have to do it. And we come back to share results so that community sees the difference their voice made. And finally, feedback and improvement. We ask for feedback. We adjust. For example, surveys are important part of providing feedback because community needs change and we need to be flexible enough to change with them. Okay, I have to take a break because of my voice. All right. These are building blocks of real lasting engagement. Okay, next slide, please. Just want to give you an example of our community engagement. This one primarily myself, being out in the community, why it's important to show up. And now let's talk about this and how this has looked in action over the past couple of months for NOMHE. So I'd like to talk about our June activities and what I've learned. I've learned from the Las Vegas. I attended an event with the Metropolitan Police. They did a wonderful DONE presentation. I've also watched a powerful documentary about adults living with mental health challenges. I celebrated Juneteenth at 2 Las Vegas locations. Next slide, please. July was the biggest of the 2 months. We planned and hosted our annual Back to School Resource Fair. And we also partnered with the Nevada Donor Network for a Lunch and Learn. And then we also, I joined the Southern Nevada Health District and the Alzheimer's Association for a community convening on brain health. Next slide, please. So I want to talk a little bit about our Back to School Fair. This was big. Not just big, it was huge. We had over 1,000 community members and 45 organizations coming together. It was people, thank you in the audience, people of all ages, backgrounds, and languages. Just to give you an example, next slide, please. Oh no, wait, stay right there. Go back, please. Okay, so we worked with the Southern Nevada Immunization Clinic to give 111 vaccinations to 48 children and teens, protecting them from preventable diseases. And then we also offer lead testing. Here's where it got surprising. We found high lead levels in common household items, even a house key that tested nearly 10,000 parts per million. Most people knew about lead in oil paint, but not in cookware or dishes. This led to important conversations about children's health and testing. So I think I skipped a couple of slides, so I apologize. But if I think I missed, there was some pictures, and I just wanted to show you the impact. Everybody that was there celebrating and getting the resources that they needed. We had haircuts, we had tons of services for the public. Okay, you can skip now. Okay, so I talked a little bit about the screenings with the NVCL PPP. We can move forward, please. And I also talked about the vaccinations. We did get 111 vaccinations to 48 children. Next slide, please. Okay. So this one was also exciting. It was a lunch and learn. We partnered with the Nevada Donor Network. We welcomed 45 attendees from over 20 organizations, plus also UNLV students and local residents in that area. We had real conversations about organ donation, what it means, and how it saves lives. Some people actually became donors right there, and others pledged to amplify the work of the Nevada Donor Network. And let me tell you real quick a personal story why I personally work with the Nevada Donor Network, not only because they're pledging to work with our multicultural communities, but this is also personal because my mother-in-law is a recipient of a kidney transplant, and she's lived 17 years with this transplant, and she's thriving. She's this little old Mexican lady, you know, going around her business, but because of the transplant, I was able to meet her. So I'm glad that the Donor Network is helping people. Next slide, please. So I just want to show you some photos of the Nevada Donor Network Lunch and Learn. I had my intern, if you see in the photo, she came with her baby to help. That's how impactful this is. Next slide, please. I do want to urge you, because we are official partners of the Nevada Donor Network, the urgency of organ donation. So right now, more than 100,000 people in the United States are waiting for a life-saving organ transplant. And that's nearly 700 Nevadans. They're on that list waiting for an organ. Every day, 13 people died waiting. And every 8 minutes, someone new is added. But here's the power in just one decision. Next slide, please. Oh, you can go back. I think there was a slide missing. The Nevada Donor Network, oh, okay, so the decision you guys have is in becoming a donor or helping communicate the message is that one organ donor can save 8 lives. And one tissue donor can heal more than 75 lives. The Nevada Donor Network works hard to share this message, especially in multicultural communities. They do this by partnering with schools, churches, and local organizations. So what I'm trying to say, people, is that community outreach is more than just programs or events. It's people helping people. Remember that. It's making sure every voice is heard, every culture is respected, and every person has the resources they need to live their healthiest life. And here's how you can help. Share what you learned today. Show up to community events. Bring a friend. And also consider registering as an organ donor. Your decision can save or heal dozens of lives. Keep speaking up for fairness in health, because when we make health more equitable, everyone benefits. Just want to thank you for your time, your attention, and your commitment to this community. Together, we can make a lasting difference. Thanks, everyone.
Thank you so much, Carlos, for your presentation and the immense work that you all are doing. Before we move on, I just wanted to ask if there were any comments or questions from our advisory committee members.
Thank you, Mr. Chair. For the record, this is Dr. Samuel Hickson. Carlos, I apologize for making you talk more. I know your voice is about to give out. So anyone from NOMHE can answer, but I just wanted to seek clarification about your lead testing because the levels reported are deeply concerning to me, and I would be remiss if I did not bring this forward. If I recall correctly from your presentation, was it correct that you found 10,000 BPMs?
That is correct.
So that's considered significant exposure. So what happens to that information? Because we are now talking about children and families being exposed to high levels of lead that can lead to extensive health concerns. So is there going to be follow-up with those individuals that had that exposure, or what would be the next steps there? As we're talking about improving health in Nevada, what was just stated is a significant impact to health of Nevadans.
And Dr. Hickson, that is a good question. I can follow up with you with that question after we address this question with our partners who participated in the Back to School Fair.
Thank you.
Thank you.
Thank you so much, Nick Dunkel, for the record. As we were looking at the presentation, you kind of mentioned immunizations and health screenings, all of these different things happening. I had a question about the immunizations in particular. Which health insurance providers were identified as part of those immunizations?
I don't have that information right now, Chair. Oh, hold on. Alex can answer that question. Yes.
Thank you, Chair. And for the immunizations, the primary insurance or payment used was Anthem, Blue Cross Blue Shield, Medicaid, UMR, which is a United Healthcare subsidiary, the local Anthem, Blue Cross Blue Shield, the United Healthcare by itself as the primary insurance, Medicaid, HPN, Cigna health insurance, and then a large amount of them were marked as self-pay.
Thank you so much, Alex, for providing that clarification. And I think good information for better understanding our communities and how they are doing things like paying for health screening. So thank you for that. Any other questions or comments from our advisory committee?
Mr. Chair, this is Tina Dorch. I'm sorry, before we get too far away from Dr. Hickson's question, I wanted to point something out. If we get, Alex, there we are. If we could rest on this slide for a moment. Dr. Hickson, this is Tina Dorch for the record. The Nevada CLPPP initiative is operated through UNLV, the School of, and they absolutely will be analyzing the results of the tests and following up with reports as necessary. So I just didn't want to give the impression that NOMHE is conducting the tests and would be able to conduct follow-up personally. But this is a program that is funded and very active through the UNLV School of Public Health, Dr. Hickson.
Thank you so much, Ms. Dorch, for your clarification. Alex, I see you in the back there.
Yes, Alex Neal for the record. Also to Dr. Hickson's previous question, the team from the Nevada Childhood Lead Poisoning Prevention Program also mentioned that in addition to following up and talking with parents, they talked to a few parents about recommended blood lead testing intervals for their children. They did hear, though, from one parent that their pediatrician did not think the test was necessary, and so they just found it as a need to continue to highlight and raise more awareness.
Thank you, Alex, for that information, and thank you, Tina, for that information. For the record, this is Dr. Samuel Hickson. Alex, I would like to say that if you have contact with that parent, I would highly suggest that parent find a new pediatrician, because that is a deeply concerning statement for a pediatrician to actively know that exposure to lead has happened. And irregardless of our personal beliefs, it is necessary for us to be preventative rather than reactive. Especially if you have not ever treated a child with lead exposure. We don't want that to become a problem, and we have no idea how long this child has been exposed to that high level of lead. So that is my personal opinion that I will put on the record, that if we do have contact for that parent, it is highly suggested they find a new pediatrician.
Thank you, Vice Chair Hickson. We can follow up with NVCLPPP to ask if they have a direct contact. And so I'm here if there's any additional questions. Okay.
PDEBs, for the record, thank you so much for sharing your experiences with Donor Network. My brother-in-law waited 7 years to receive a kidney, and he finally got one. But 2 years before, my cousin died the day before receiving a kidney. With that said, I think it's always great to hear what's happening in southern Nevada, but boy, I feel like I'm a broken record in saying that we need to get more initiatives here in the Reno Sparks area that's coordinated and partnered with NOMHE. We're the best kept secret in our communities, and would love to figure out how we can do that, because African Americans, people of color, are often at the tail end of receiving transplant organs, and we really do need to heighten the awareness here in our community.
Thank you so much, P-Dubs. Nick Dunkel for the record. Appreciate your comments, as well as the others made by advisory committee members. I believe Maggie also has some thoughts.
Maggie Salas Crespo for the record. Just wanted to ask, I know in the past, NOMHE has also done some of those outreach events up in Northern Nevada. Has there been any discussion or consideration of doing the back to school fair in Northern Nevada, or kind of change it each year? I do think to P-Dub's comment that it's important to do that outreach out here, and also the exposure for NOMHE to continue to grow partnership as well.
Thank you, Maggie. I can quickly answer. I can answer to that. Maybe Alex also wants to answer to that question. But again, it's due to lack of funding and lack of staffing. We would love to be here in Northern Nevada, but it takes a lot to put an event like that. But thank you for your question.
And then I'm also seeing Nick Dunkel for the record. I'm also seeing our program manager, Ms. Dorch, with their hand raised as well.
Thank you, Tina Dorch, for the record. And thank you for the question. Obviously, we would, and Carlos is correct, it's bandwidth that prevents us from having the same type of presence throughout the state. But it's also why we have our morning annual partner breakfast. And it's also something that we can make a commitment to perhaps hold educational, informational sessions where we can explain how we've been able to conduct these sessions here in the South, even if we're not able to be the lead facilitator. We're absolutely happy to help lift up others who can then carry it out in our absence. But just want to say we acknowledge the need. And to Carlos's point, there are folks here in the North who know their communities. And I think they would be the most appropriate front-facing entity to conduct such an event. And we'd be happy to just share our knowledge and how we've been able to take these things under our belt. Thank you, everyone.
Thank you so much, Ms. Dorch, for your clarification there. And ahead of moving on, just wanted to also agree with P-Dubs in kind of the concern, as well as Maggie for Northern Nevada as well. We recognize it's a bandwidth issue. And if there are other ways that we might look to kind of mitigate that, as well as to Ms. Dorch, to your point, connect with community entities, I think maybe we as advisory committee members could talk about something that we could do together, or meet with maybe community folks to get something like this going. I know Ms. Dorch, Carlos as well, Alex, all of your team did really great work on these events, whether it was upstream prevention as well as identifying, to Dr. Hickson's point, very concerning information about exposures as well. So thank you so much for the work that you're doing, and for us folks in the northern region, I think maybe we should have some conversations about what this can look like. With that said, I think We are ready to move on to our next agenda item here. Thank you so much, Carlos Ramirez Gomez, for that presentation. Next, we have Dr. Siddharth Raich, who will be presenting on NOMHE's 20th anniversary related efforts.
Wonderful. Thank you so much for that introduction. I will be talking about the 20th anniversary efforts as well as some changes that we've made to our NOMHE webpage. So if you could please direct your attention to the screen, my colleague Alex will guide us through highlighting some of these changes. And these changes are made to be very succinct and to help direct your attention to those resources. We have a new link that goes straight to the General Advisory Committee meeting information. That can be accessed directly from that hyperlink there. As to circle back with what our program manager, Tina George, said earlier, starting with the June 2025 meeting, we will also have recordings available to listen for any partner that may miss this meeting. And I will highlight later on as well where these recordings will be found. And as you can see on the screen, there's video recordings of that. I also want to draw your attention to the new section on the right side. We have health literacy products and partnerships. This highlights a lot of the commonly accessed resources that folks have been asking us about. This includes reports, toolkits, cultural competency training resources, and many other resources. So those can be accessed directly on the right ribbon that you're seeing on your screen there. For those that have attended the meetings in the past, I also want to scroll down just a little bit and show you some past and upcoming flyers that we have that we've highlighted. So if we open the page for past events, you'll see all of the wonderful events that my colleague Carlos mentioned, some of the flyers for those events, the back to school fair in July, and these flyers going back several years. Some of these events are repeat events, so the back to school event we do every year. So please look out for the upcoming flyers a few months prior to the event in 2026. Then I'll also guide your attention to celebrating 20 years of NOMHE. So NOMHE has been working on recognizing our 20th anniversary. As you know, we were established in 2005 by the Nevada legislature. So we've added a section on our website, and we've kind of given it some information of getting to know me with the pun that we're working on there. We're going to have some testimonials. We're going to have a look back at notable events. We're going to have an introduction to appointed leadership, as well as recognition of champions that will be coming soon for those that have advanced NOMHE health equity. Speaking of personal testimonials, I do also want to highlight that we've been posting NOMHE's digital media on the right side, and this will take you straight to our current playlist, where you'll see our NOMHE YouTube playlist. Just a second. Once you click that, you can access the playlist here, and you'll be able to see some of our resources, discussions regarding commercial on the impact of misinformation. You'll also see some resources in Spanish. You'll see some videos of Black maternal health awareness, or some virtual roundtables, and you'll see a lot of other resources. So I encourage you to please take some time and watch some of these videos. As I mentioned, we'll have some testimonials that will be coming up on our website soon. So look out for a tab that will highlight those testimonials. With that, I do want to take a second and show you a sample of a testimonial that we will be working on. Let me actually circle back to that at the end. If we can scroll down just a little bit, I'll have a video for you all later on. You can also see some of our resources on clinical research. So the first link does go directly to DPBH website, and the second link under the brochure will allow you to download this brochure. Thank you to Dr. Hickson and several other team members for your input with these resources. These have been requested by community members repeatedly, and this will help folks partake in clinical research so that it's representative of all groups in all populations, which is what NOMHE and the team strive to do. With that, we'll scroll a little bit higher, and I do want to show you one video testimonial that we currently have in progress from the Dean of the School of Public Health, an interview that I conducted. So Alex, if you're able to play that small clip.
The third one is an interesting question as well. What do you see as NOMHE's potential for future impact?
Well, we certainly have not solved all the problems, right? There are still things that remain. There are still issues that occur. And I think NOMHE really can act as that guiding light to say, here are the issues that still remain in our community. How do we identify those? How do we prioritize those? How do we make sure that the state, the universities, our nonprofits, our community partners are working together to maximize our impact? And I think that's been NOMHE's role for a very long time, is to pull all these complicated pieces together, align resources, and then move the needle to improve health outcomes. So going forward, we have work to do. We still have disparities. We still have disproportionate burden of diseases in populations. And I do think that we can certainly prevent, reduce, and hopefully in some cases eliminate those disparities if we work together, and NOMHE kind of acts as our North Star to guide how we get there.
Wonderful. Thank you to Dr. Gerstenberger for those wonderful words about NOMHE. I do also want to say that we are close to completing the testimonials, and we're working on getting another Northern Nevada voice and testimonial. So if anyone has a suggestion, or if you volunteer to be that voice, please indicate so in the chat virtually, or let us know by reaching out to our program manager, Tina Dorch, as well. So we're looking for those voices. Don't be shy. Please definitely reach out. And look for those changes upcoming on our website. We'll have a list of all the video testimonials for all of the folks that have participated, and you'll be able to see that as well. Wonderful. That is everything that I wanted to highlight for now, Chair, and I'll pass it back to you.
Thank you so much, Dr. Reich. Nick Dunkel, once again, for the record. Your presentation was great. Love the work that you all are doing and how clean the website looks, as well as the amount of resources that you're providing in a condensed, readable space there. So wanted to commend you on that. With that said, do we have any questions or comments from the advisory committee members on the presentation?
PDFs for the record, thank you so much for your presentation. Certainly would love to lend my voice to the as a representative of Northern Nevada, and also would love to just coordinate how we might celebrate up here the presence of a great organization. I think it's an organization that very few people know, especially people that absolutely needs to understand that we have advocacy at high levels, and so whatever we can do here, love to be a part.
Other questions or comments from the advisory committee? Hearing or seeing none in person or
actually Mr. Chair, sorry about that. This is Dr. Samuel Hickson for the record. I did have a question. I see a lot of the resources that are geared towards sort of the community members, which is fantastic. Love the website, love the design, think it's very easy to read. As you mentioned, Mr. Chair, in the networking breakfast this morning, we do live in a time of uncertainty, and that also includes providers as well who are unsure about the ever-changing landscape of healthcare. So many of them, as we know, don't know where to turn, what resources to do, who to talk to. Are there any resources on the NOMHE website that can guide or direct community providers on where to turn for certain questions? For example, one of the issues that we face right now, as we just saw in Las Vegas, are ICE raids that happen at medical facilities, and what do we do and where do we turn? We all know the standard ethical ways of responding to that, but there are also legal ramifications for that as well. So I just wanted to know if there would be some subsection or if they are embedded within those links that you mentioned.
Mr. Chair, this is Tina Dorch. I can answer the question. Yes, Vice Chair, there are some instances where content and resources are embedded within some of those links, and it does take some navigation to become familiar with where to find those. But also, as I mentioned, with the reorganization of the Department of Health Human Services, and we are going to be looking at how NOMHE can better amplify the work of the remaining divisions of the department and the new health authority. So this is not the end when it comes to the rebranding of our webpage. Your question is absolutely spot on in that it is intended to be more content driven. We want it to be a place, a location, a landing spot for people who need access, who need information and education, and to be aware of activities. So hopefully it's coming together and that is becoming evident in the way it's being rebranded. But yes, short answer is some of it is within existing content, but there will be even more very, very hyper-specific content and areas of the webpage that addresses your question.
Manager Dorch.
Thank you so much. Nick Dunkel for the record. Are there any other questions or comments from the advisory committee? Hearing or seeing none. With that said, I'd like to move on to our next agenda item here. Let's see, we got for information or discussion only, our community wellness related impacts of legislation passed during Nevada's 83rd session. This is legislative outcomes and impacts on our Nevada's tribal communities, and this is going to be presented by our advisory committee member, Ms. Angie Wilson.
Thank you. Actually, if I could just take a pause, a beat, Mr. Chair, this is Tina Dorch. I did have by way of an opening remark to lead into this section.
Thank you so much, Ms. Dorch. Please proceed.
Thank you. I'm sorry about that. I didn't mean to take over the agenda, but it's just such an important piece of information that we're going to share in this particular agenda item. And the state of Nevada, as well as other states, we have a resource called Fiscal Notes. It's a nationally recognized legislative tracking platform, not just used by Nevada, but we all have adopted it. This is the second legislative session and is meant to augment our electronic legislative information system, or NELIS, as many of you know. And one of the things that it reported out on is that almost every state legislature has started wrapping up their 2025 sessions. So we're really, at a good point in time where we can start doing a step back and examine where our legislative activities was most intense and which states were even most productive. And we're going to just be given that information by our own advisory committee members, which is something new for us as well as an advisory committee, to have our members step in and offer their, again, subject matter expertise this way. But before we hear from them, just wanted to point out that the pace of legislation and the development of such, it really did surge in 2025. But that surge really was witnessed across state houses. State houses across the country, they really introduced a record number of bills, an increase of 55% by, according to the Fiscal Note resource, an increase from 2024 of 55%. By contrast, the United States Congress has introduced just over 10,000 bills in 2025, with only 2.3% of those bills actually getting enacted. So Congress has a lower effective rate than all but 4 states. And I think that's important for us to really ponder as we listen to our advisory committee members give their presentations, especially as Nevada contemplates hearing a special session. Our governor has the ability to call a special session. And if that does or does not happen, it's not too soon for us to start thinking about our next legislative session and to build a strategy. But for now, Mr. Chair and members, I'd like to turn our attention to our local outcomes and to two of our advisory committee members who have graciously agreed to apply again their respective subject matter expertise, and importantly, to provide their summary and perspective on two categories that came out of the 82nd or 83rd session. And first up, I'd like to introduce Ms. Angela Wilson, who is the Executive Director for the Reno Sparks Tribal Health Center.
Thank you. I appreciate it. I'm really honored to talk to the committee today and just talk a little bit about the bills that had gone through. You know, in tribal communities, you know, we do things so differently. So we work with our tribal governments, they're sovereign nations. They're just like if we had to, you know, deal with the new administration coming in. Sometimes in tribal communities, we have to deal with the new tribal administration coming in. And so, you know, there's action items and laws and ordinances that get passed at a tribal level. So sometimes when you come from that base and stepping into the state legislative level, it's a foreign world to you. So that it was very much foreign to me. So just know that. But one of the things that I love is tribal advocacy. So even though my entire career has been dedicated to really working as a tribal health administrator for tribes. And so the one thing I really love about that's the passionate side of what I do is tribal advocacy. And so I'll just go through some of that. I think it's really important to kind of lay some of the groundwork on what this relationship looks like between the state and the tribes, because it is unique. So I wanted to provide a little bit of that today for the committee. And thank you so much for assisting with the PowerPoint. So I'd just like to talk about, you know, the United States of America has a unique historical, legal, and political relationship with our tribes, with our tribal nations across the board. And this has been established and confirmed by the United States Constitution, in federal law, in Supreme Court case law, and in multiple presidential orders since the beginning of this nation and throughout different administrations. Born out of this relationship is the federal government's trust responsibility to protect the interest of tribes and including the provision of quality health care to American Indians and Alaska Natives. And this commitment underscores the necessity for ongoing tribal advocacy as it ensures that the healthcare promises are upheld and adapted to meet the evolving needs in our tribal communities. Tribal advocacy is crucial in voicing concerns, pushing for policy changes, and securing resources, therefore playing a pivotal role in maintaining and improving healthcare outcomes for American Indians. And just for a very minimal moment, I'll talk to you about an example of that was the One Big Beautiful Bill, which is very concerning to us in Indian country, in all tribes across the nation. And in this bill, we had to do a lot of advocacy, a lot of education to the new incoming administration on the federal trust responsibility. I know we were very vocal from the Reno Sparks Indian Colony in writing letters to members of Congress, both the majority and minority, about the federal trust responsibility. And as such, when the bill passed, there were exemptions for American Indians, acknowledging the distinct needs and sovereignty of our tribal communities. And these exemptions aim to ensure that the unique critical cultural, economic, and social aspects of our people are respected and preserved. But it feels like what we said earlier today when I made the comments, it's not something that just comes natural. We have to continue to advocate for it, remind them of the federal trust responsibility, and fight for it every step of the way. So a lot of the laws that have been passed, the policies that have been passed, has been such incredibly hard work happening in Indian country over time. And that's where resilience will come from in this administration and others that'll be forthcoming. And so despite these provisions, again, there remains strong need for continual tribal advocacy. So I wanted to just preference that from our relationship with the federal government and how that looks. Just prior to the 83rd Nevada State Legislative Session, I received a telephone call asking if I would be willing to do a presentation to the Joint Interim Committee on Health and Human Services. And I said, sure, I'd love to. What would you like me to talk about? And, these are assemblymen and senators from both sides of the aisle. And they said, well, what do you think is important for us to know? And so I think that it's really important to know about how the state plays a role in tribes being able to access the federal responsibility, because we do that through our states, the relationships that we build with our states. And not every state is the same. And I will just say that in this state, we have a great working relationship with the state of Nevada. Sometimes we're on the same page, sometimes we're not, but I think the commonality of having those relationships are really key. And so that happened during this process. After that presentation, the Joint Interim Committee advised me that they only have so many bill draft requests that they can do as a joint committee together, and they would like to do one that supports the initiatives for tribal health care. And so Senator Donate, the chairperson of the Senate Committee on Health and Human Services in the state legislative session, contacted me and said, we'd love to support, but we don't know what's needed. So we really invite you to write a bill. And of course, yeah, no problem. And I walked away going, oh my God, I've never written a bill. What are we going to do? So that became the drafting of Senate Bill 312. And I think what is so important is to look at how do we set the stage for what can come many generations after I'm gone, after other advocates are gone, that will continue to solidify and expand and complement the relationship between the 28 tribal nations in the state and the state. And so with that, we decided to focus on building the Nevada Tribal Health Authority Council. So during the 83rd legislative session, that significant collaboration took place between the Reno Sparks Indian Colony and the Senate Committee on Health and Human Services. Together, we worked on the development of Senate Bill 312, which did lead to the establishment of the Tribal Health Authority Council. And really, this effort was aimed to address concerns and disparities in our tribal communities and how do we get effective resources out there. Many people don't know that American Indians and Alaska Natives who are Medicaid beneficiaries are 100% reimbursed. The cost of care is 100% reimbursed to the state. So this is why you would really want the state and the tribes to work together to figure out how we can expand services and extend 100% federal medical assistant percentage to the state. So in the drafting of Senate Bill 312, the Health Authority really is to focus on expanding those health programs, leading to better health outcomes for our tribal communities and for those generations to come. And so, like I said, I'm not used to the state legislative process, so watching these bills and advocating to the different committees, many different committees, it felt like meeting with assemblymen and senators individually. It was right in the change of this federal administration where DEI was also coming out, very scary issue, like, can I talk to you or can I not talk to you? Felt so it gave us an opportunity to also educate our state lawmakers on the federal trust responsibility and where tribes fit into that process. So Senate Bill 312 was passed during the session, led to the establishment of the Health Authority Council, and some really great things came out of that. In the overall bill, it not only establishes the Nevada Tribal Health Authority Council, which is comprised of voting members of the council. Those voting members will be the Nevada Tribal Health Directors or their designee. And we also have voting members to the council, which is also will be comprised of our state tribal liaisons with the different divisions of the state. It also establishes the account for tribal health in the state general fund, and it appropriates a state, it gives a state appropriation of $224,000 to the Department of Native American Affairs to hire the personnel and to absorb the operating costs for the council. It authorizes the council to request up to 2 legislative measures per each legislative session, and this has never happened before. And so what was really key was all of the counties were getting, I think, two bill drafts. The tribes have never gotten any. So it was remarkable to look at, we were able to include, this process for the 28 tribes. So we're very excited about that. And also during this time, while we were developing this, we were concerned about what this one big, beautiful bill will entail. We knew that it was really centered around deterring Medicaid, getting folks off, getting people off, not doing redeterminations, making it harder for folks to come on. And so we felt it was really important to also include the authorization for our Indian tribes to determine presumptive eligibility for Medicaid benefits. And this is really important because a lot of people do not understand that American Indians and Alaska Natives who access care through our tribal clinics are required to sign up for Medicaid to even access Indian health services or tribal services. So it's a condition of them being able to even access care. So this was a really key initiative for us. So very excited about Senate Bill 312 and working with the Division of Native American Affairs. Very excited for that as this starts to roll out. The additional bill that we worked on was Senate Bill 97. And Senate Bill 97 is really critical because the Affordable Care Act includes various provisions in the law that are very specific to enrolled members of federally recognized tribes. And this also allows, the Affordable Care Act not only allows those provisions for things like open continuous enrollment, so American Indians, Alaska Natives who are federally recognized and enroll in healthcare plans through the entire year. They're not to just the open enrollment period. The other issue is that they can have, if they're in a plan and they're seeing their tribal clinic and they get a referral for specialty care, they can qualify for 0 to limited cost sharing. So no additional expenses, co-pays, deductibles, those types of things. But what it also allows is the law also allowed American or our tribes to be able to sponsor the healthcare premiums for our patients, for members who are federally recognized. However, in this state, because we're in a state-based exchange, there was no pathway to tribal sponsorship here. Despite our advocacy for that, there were other needs of the exchange, that we had changeover of leadership in the exchange. And so we really had to work on advocacy. And the difficulty here is it would be the equivalent. I am not a veteran myself, but if I were trying to make decisions on the veterans healthcare system and didn't know anything about it, it'd be difficult for me to do that. It's the same type of situation here. So if we have the exchange who are giving input but are not familiar with the Indian health, tribal health, or urban Indian programs, it's really difficult to make decisions if you don't know that specific healthcare delivery system. And so what we did advocate for was that Senate Bill 97 would make changes to its makeup of the board. And so Nevada Senate Bill 97 did change, and it makes revisions to the Silver State Health Insurance Exchange. Specifically, it modifies the composition of the board of directors. The bill mandates that one of the governor's appointees to the board must be a member of a Nevada Indian tribe with expertise in tribal health care administration, and that this addition ensures better representation and expertise in the tribal health care within the exchange's governing body. So these were big changes for us in the tribal world. We're super excited about about those and just really looking forward to strengthening our relationship that we have with the state in this effort. So very exciting for the tribes to be able to come through and have a lot of advocacy and move that advocacy into action with these two bills. So I'd entertain any questions or comments.
Thank you very much, Representative Wilson. I did have a question as a community provider, because I think Native American health and Indian health and tribal health is something that I think the North does very well. In the South, we struggle. And my question is, at least in my practice, we have a lot of First Americans, Native Americans that come to seek mental health. And often what happens is they are told to go to the Intertribal Council to get connected, which I think is a disservice. Because we want to expand resources. As I was discussing earlier, there are over 3,000 therapists in the South. So how does this bill and the information in these bills get disseminated to the community providers at large within the state so that we know how to better help our Native American, Indian, First American, our patients, our clients, people who really need access, that are so disconnected from their tribal communities, but they are still connected to their tribal communities, if that makes sense.
Yes.
And I just would like to know, how do we disseminate this information so that we can help all throughout the state of Nevada?
I thank you for the question, Angie Wilson, for the record. I just want to say it's a great question, and it really does provide the premise to why Senate Bill 312 was so important. A lot of times, if I'm the director of the Reno Sparks Tribal Health Center, I really have a commitment to that service delivery area that I'm responsible for. So I'm working always really hard to do that. In the advocacy that we do, I really look at that from a perspective of how does this impact the other tribes, because really we have to cover all of the different service delivery areas that are specific to those tribes. The beautiful thing here is to be able to create a table and then create the seats at the table. And, the Reno Sparks Indian Colony just celebrated these acts. And one of the things I said was, it's now our responsibility as tribes to take that seat. A seat's been created, it's now your responsibility to take it. And I think that with that better collaboration and communication, not only amongst the tribes who will be represented at the seat, but it also creates a pathway for that collaboration, not only with our state tribal liaisons, but with other agencies. And one of the beautiful things that happened during this legislative session, while we were giving testimony to the multitude of those committees for it in order to for it to pass, I was really just so pleased and so heartfelt thank yous to several folks in the South and in the North, agencies that came forward and said, oh, we would totally support this because we've never known how to reach out to the tribes, and we've got services and resources that could really help, but we didn't know the appropriate way to contact them. So I think this is what Senate Bill 312 does, is it creates that atmosphere. When I look at Clark County, I'm concerned as a tribal advocate because I know the largest population of American Indians, Alaska Natives, and I'm assuming because of the workforce level, are in Las Vegas. But the Las Vegas Paiute tribe has a small clinic that it may only be seeing a particular service delivery area. So this is a pathway for us to create, identifying what are those barriers and then how do we create those resources around it. So it's an excellent question, and it kind of just goes to show the importance of why Senate Bill 312 is really, really critical.
Thank you so much, Angie Wilson, for your presentation. I just wanted to open it up for any other additional questions or comments from the advisory committee. I have Nick Dunkel again for the record. Less so a question, but more of a comment. Just thank you for the work and the advocacy that you're doing in this area. When I look at these bills, I I'm seeing representation, and I'm seeing real efforts for advocacy for our Native populations in the state. So I think it's so needed for a lot of the reasons that you described, and I think this can lead to some really great things. So thank you so much for the work that you're doing.
Great, thank you so much. I just want to say also to Tina and the team, thank you for allowing me to speak on this. And I just want to say that if there was anything that I can leave here with, I would have never imagined we would have gotten anything like this. I would never imagined that we would hear, we want to support you, we don't know how, but maybe if you can write a bill. And maybe it was a good thing that I didn't know what I was getting myself into, so the fear wasn't there. But I think that this is why earlier when we were talking about the importance of resiliency, continuing to push forward, we're in a new administration. You can see the pictures there with Secretary Kennedy that we had one-on-one. Those are sometimes difficult to be able to educate him. And, of course, we met with Dr. Oz as well. I sit on the National Centers for Medicare and Medicaid Tribal Technical Advisory Group representing all of the tribes under the Phoenix area. And so having these conversations to educate folks is really critical. And I think for all of us who represent people that are in marginalized communities, I hope that this also just brings inspiration that really something can come out of an area that you would never expect it to, as long as we continue to be that voice and love the passion that we do and continue to follow it. And I just want to say thank you. Thank you for the comments, and thank you to Tina and her team for allowing me to present on it today.
I have one last question before you leave, if you don't mind. Maggie Salas Crespo for the record. First and foremost, I definitely want to congratulate you. As somebody who has ran bills in the legislature, I know how hard it is and how hard it is to chase not only legislators, but just make sure that your bill is moving along. So great, amazing work. My question is more so to continue to offer you that support as part of this committee is, when does the bill go into effect? If you can explain a little bit of the process, because I know how difficult implementation can be of certain legislation. And then also, what can we do to help support the successful implementation of this legislation?
Well, that's a great question. The bills were signed by the governor, and they were provided to us copies directly. And the state is already moving forward on Senate Bill 97. So those nominations are going in. So we're very pleased about that. They've been in contact with us. And the Department of Native American Affairs has also been in touch with us as they start to look at the development of the personnel who will be hired to assist with setting up the committee work grounds. And so it's exciting to see that those things are moving through the pace right there. And I just want to say one last comment to our working relationship with the state. This is a new administration. You got two different sides of the house, but I'm really happy to report that both of these bills made it through every committee and the final approval unanimously, which should be a real amazing thing to see for the state of Nevada. So every single step of the way, every single committee unanimously. That's awesome for Nevada.
Andrew Reyes for the record. Angela, I just want to acknowledge you for stepping up. It's almost like there's a gift, an opportunity, and then you just really step up. And I think this is a demonstration of good leadership and resilient leadership. And I think this legislation is a strategy, and it's not the end goal, and it's just the beginning of increasing access, healthcare access to many, especially to the tribes. Yeah.
Thank you so much. I appreciate it. Thank you.
Thank you so much, Dr. Reyes, and thank you, Angie, once again for your presentation. A difficult task to undertake, and I think you did so with candor, and you did very well. So thank you so much for that. With that said, I know that we have one more presentation to jump into for the agenda. So with that said, I'd like to introduce our additional advisory committee member who is not here in person but is online, Ms. Nancy Bowen, to talk about legislative outcomes and impacts on community level access to care. Nancy, please take it away.
Thanks, Nick, and thank you for allowing me to do this virtually. I am a little overwhelmed at the moment with everything that goes on the federal and state level. So just a brief history of the Nevada Primary Care Association. We're the Association for the Federally Qualified Health Centers, otherwise known as community health centers in the state. We also do support tribal health centers and nonprofit organizations that work with our health centers. For those who don't know, a health center, we provide primary, behavioral, and dental care to vulnerable populations in underserved areas. And they see patients regardless of the ability to pay. So they see uninsured and insured patients alike, same quality of care. Our organization, like NOMHE, strives to increase access to healthcare and improve the quality of healthcare to the vulnerable populations. And I'm going to go over sort of like bills that happened this past legislative session. There were over 500 bills that were signed by the governor and passed into law. And I just picked a few that I thought was most relevant to the work of this advisory committee. So next slide. I can't move the slides, so I don't know. Okay, thank you. So these are just a view of some of them. We're going to go over the PACE program, some scope and compacts, some loan repayment programs, and primary care training. And then I can try to answer as many questions as I can. All right, next slide. So the PACE program, which is a program for all-inclusive care for the elderly. Before I go into, I just want to tell you like the details of it, because I think it is so very important to the community that we serve and to the communities that that the advisory committee participates in. It's a comprehensive, fully integrated provider-based health plan for the frail individuals that will require nursing home level of care. However, the PACE philosophy is to keep them out of the nursing home. So it is centered on the belief that it is better for the frail individuals and their families to be served in the community whenever possible. And at a national level, about 95% of the PACE participants actually live in their home. So it's all about keeping the patient in their home. And most PACE participants are 76 years old, have multiple complex medical conditions, either cognitive or functional impairments, and significant or long-term healthcare needs. However, to participate in the PACE program, you need to be 55 years or over and certified by the state as needing nursing home level care. And most participants are duly eligible, so they're on Medicare and Medicaid. And they live in what is called the PACE program service area. So the benefits of a PACE program are primary and specialty medical care, in-home services, prescription drugs, specialty care such as audiology, dentistry, optometry, podiatry, speech therapy, respite care, transportation, adult day services, including nursing, meals, nutritional counseling, social work, personal care, physical, occupational, and recreational therapies, and hospital and nursing home care when necessary. So it's a lot of things that are included in this PACE program. PACE organizations are often part of a larger healthcare system or organizations, including hospital systems, medical groups, federally qualified health centers, area agencies on aging, hospice organizations, and collaborations amongst all those entities. And I have heard from several of our federally qualified health centers that they are very interested in participating in the PACE program, either becoming a PACE organization or partnering with another organization, just depending upon that organization side. So I'm very excited about that. Actually, the bill, SB 207, Senate Bill 207, was introduced by a federally qualified health center and sponsored by Angie Taylor, and it passed. It did have a fiscal note, which, as we all know, fiscal notes can be very harmful when it comes to bills, but it did pass with a fiscal note, and that fiscal note is basically to higher contractual cost, or it's for contractual costs to ensure the PACE program will be in compliance with the federal law, and then to hire staff at that, it'll be under the Nevada Health Authority. So, and the PACE program becomes effective January 1st, 2026. So we'll see some FQHCs, ramp up and try to go after that, and also some outside organizations. And okay, next. All right, so there were some changes sort of like in the scope of services. So one of them was Senate Bill 118, and it was very much directed at expanding the scope of services for pharmacists. This bill would have mandated that Medicaid covers services provided by pharmacists if those services fall within the scope of practice already covered when performed by other healthcare providers, such as physicians or nurse practitioners. Really created payment parity. It was to create payment parity. Reimbursement rates for pharmacists would be equal or greater to of those other professionals for similar services, and prior authorization requirements would align with those other providers. Overall, the bill was to improve access to care by recognizing pharmacists as essential healthcare providers and ensuring equitable treatment under Medicaid. Unfortunately, the bill did not pass. It did pass out of the Senate Health and Human Services Committee, and it was moved to the Assembly, where it unfortunately did not get a hearing. So, but that does not mean, that there's a session going forward. I'm sure it'll come back. So the next bill is Senate Bill 300, which expands Medicaid coverage in Nevada to include additional behavioral health services at federally qualified health centers. In a nutshell, it's going to let us, the federally qualified health centers, bill for certified professional counselors and licensed alcohol and drug counselors, which is a great benefit to expanding behavioral health services. We're very excited about this. It also did add some new coverage, or actually sort of require Medicaid to include that services, and to the extent that federal financial support is participation is available. So it requires the state to seek federal waivers and amendments. That will become fully effective October 1st. And it aligns the Nevada Medicaid program with the recent federal changes and aims to improve the mental health and substance use disorder treatment statewide. So I'm very excited that that passed. The next was some compacts. One passed, one failed. So the first one, I always like to do bad news first in my world, because I like to end with good news. So AB Assembly Bill 143 was for dentists and dental hygienist compact. This would have if anybody doesn't know, I'll go backwards and say what a compact is. So a compact is an interstate agreement that allows licensed professionals from outside our state that participate in the compact to practice in Nevada. And so they don't have to go get a whole nother license. They can use their license and practice in our state. So we tried to get one for dentist and dental hygienist. Unfortunately, it did not pass. Again, the concept of compacts is that it addresses the improving access to care and all the workforce shortages that we have in our state on all levels of provider care. One that did pass was Assembly Bill 163, and that was for certified professional counselors. So it is a counseling compact. It allows Nevada to accept CPCs or certified professional counselors licenses from other states. This will allow for the sharing of certain information with a coordinated database and reporting system created by the compact. And it was unanimously passed in both chambers, and that will be effective January 1st, 2026. So next slide. So next is the Treasurer's Loan Repayment Program. So this was originally enacted in 2026, which was great. They used the funds from the unclaimed property for flexible student loans repayment for healthcare providers in underserved areas in Nevada. So AB 269, Assembly Bill 269, adds licensed marriage and family therapists and certified professional counselors to that list of applicable providers, which is really quite long. So that is really good. The additional providers that were added underneath AB 269 were licensed speech language pathologists, physical therapists, occupational therapists, and certified problem gambling counselors. And so AB 269 is effective October 1st, 2025. And then a very, very similar bill, Senate Bill 266, which adds licensed and marriage family therapists and licensed alcohol and drug counselors to the Treasurer's Loan Repayment Program. It also passed, but that was effective July 1st, 2025. So very similar. Truthfully, I can't tell you why there were two that were so similar. Usually they'll try to blend those two together into one bill. Didn't happen this time. So next slide. So we were excited about this. This is a primary care provider training program. So little background, our staff and our policy director, Steve Messenger, met with Stacy Weeks in Medicaid in early 2024 to talk about how we can really sort of enhance the graduate medical education program in Nevada to really increase primary care, because there is a primary care shortage along with other provider shortages in our state. And so during those discussions, I think Stacy was able to get with some legislators or however it works. But it was seeking to establish a grant to facilitate graduate medical education, otherwise known as GME, in community health centers, and then be able to utilize the federal match through Medicaid. And to do that, they had to do a few things, and SB 262 was a first step. So Senate Bill 262 transfers the administration of the Graduate Medical Education Grant Program and that account from the Office of Science, Innovation, and Technology from the Governor's Office over to Medicaid, which is now underneath the Nevada Health Authority. It expands the purposes of which the institutions or organizations that provide residency training programs may receive grants under the program. It sets up that GME to be matched through Medicaid, so that including accreditation grants that organizations like the FQHCs will be eligible for. You have to get accredited before you can even start doing a residency program. It's when I look at it, it's like a 5-year program. You got to start with the accreditation. You got to find the funding, and then there's 3 years of the first residency program. So it is a really big commitment on organizations, but I think it's extremely valuable for our state because we all want to grow our own residency programs, and those who go to our universities and our schools of medicine, we want to keep them in our state. So this bill gives priority to programs that will leverage the funds from the federal grant or private persons to maximize the impact of the grants. It'll incorporate innovative delivery models such as telehealth, rotations in rural areas, and training in underserved settings. It provides logistical support such as transportation, housing, and accommodation for family members of residents and fellows to facilitate the placement in rural areas. That's one of our challenges. Nobody wants to go out there, so they're going to help with the family members and the placement of those in the underserved and rural areas. Programs must demonstrate collaboration with rural hospitals, community health centers, otherwise FQHCs, and other local entities that provide healthcare. And they must address the geographic areas and populations where the shortage of providers of healthcare is most critical. So this was passed unanimously in both chambers and became effective July 1st, 2025. And then the next one was SB 434. It was very similar to Senate Bill 262. However, the bill asked for a $50 million appropriation for grants to organizations providing healthcare workforce training. It failed, similar to like why the two bills passed underneath the compacts, but this sort of like 262 won out over 434. All right, and then next slide. The last one was SB 307. It's very relevant to the Minority Office of Minority Health because there's a bill around it. Sorry for the typos. I apologize. I looked at that and went, that's painful. But it would have required, if passed, it would have required the Office of Minority Health and Equity to analyze and identify the gaps in health and human services delivered to minority groups. It would have mandated analysis of those health gaps, do a data collection, and then annual reporting. It was introduced, but it was never heard in committee. So it just sort of died. And then there was one more bill that didn't make it to the sides. And it was Senate Bill 124, which is physician workforce. It increases the diversity and pool of qualified providers by authorizing internationally trained providers to practice healthcare in Nevada with a limited license. So this is great. They can be employed at federally qualified health centers, county hospitals, health districts, medical schools in the Nevada system of higher education, and facilities operated by DHHS, a nonprofit facility that provides behavioral health care or primary care, or at a physician group practice that is located in a medically underserved area. And that bill became effective July 1st, 2026. So any questions? I will try to answer them as best I can.
Thank you so much, Representative Bowen. This is Dr. Samuel Hickson for the record. I have quite a few questions, actually only two. However, I do want to first state that I really appreciate the work that you and your group have done in terms of getting many of these bills passed. As many know, my biggest frustration was the issues of the state compact licenses, as the Board of Social Work's compact license also did not pass for varying reasons. I also don't feel that that should be a legislative issue, but here we are when we're talking about increasing workforce development in our state and the barriers that come with that increasing. But be that as it may, I did have three questions. The first regarding the PACE program. Can you help me understand why that program is solely relegated to individuals that are 55 years or older when there are other populations that meet a frail status that also may require nursing home care?
It is a regulation of the Centers for Medicaid, and so it's CMS, Centers for Medicaid and Medicare. It is a federal regulation. Beyond that, I can't. I agree with you. There are individuals who would need these services but cannot. But it is part of the federal regulation.
So the follow-up to that are individuals that are disabled that also might be on Medicare that also receive Medicaid. Would they not then qualify for that particular program if it's a CMS guideline?
If they are 55 and older, they would qualify probably. But if they are under, then no. It would be. There isn't a program that I know of. I mean, this is I think in about half of the country. When I looked at the map, the PACE programs, it's actually exciting that what the bill actually did was our Medicaid department could have done a PACE bill. It had the option. This bill basically requires them to start a PACE program. So
perfect.
But yeah, I can't answer. I don't, it's that age limit and it's set by the federal government.
Understandable. My follow-up question to that is that we currently have programs that are very similar to PACE that also have year-long waiting lists. How does PACE anticipate attempting to rectify that problem when we already had similar programs like COPE that also works for the same kind of pathway that has a 2-year plus waiting list?
I'm not exactly sure about the waiting list. I do know that there are several organizations that are excited. We have, like I said, the federally qualified health centers. There are outside organizations who run PACE programs in other states that are wanting to come in. It's going to take, even though it was effective, it's going to be effective January 1st. I believe that's what it was. It's going to take a while for them to get ramped up and running. I hope that we have enough programs in our state that we don't have waiting lists, but that's a difficult question. I mean, there are waiting lists for primary care as it is now, to get into it, see a doctor, depends on where you're at. It could be, 1 week to 1 month or more. Yeah, which is unfortunate.
Thank you very much for that. My second question regards the counselor compact, and you may not have an answer for this, but one of the things that we have heard thus far about the implementation of that compact within our state is the prohibitive cost for counselors to get a compact license. My question regards how do we anticipate increasing workforce development when the cost to obtain that license would be prohibitive?
if it's a yeah, I truthfully, I don't know have the answer for that. That might be something that might be, is it that they are part of the treasury loan repayment? Is there something that we can do in future legislations to say, okay, how do we prohibit the cost? I mean, that's something that, even I believe I was reading the bylaws and we can legislative suggestions. So that might be something that we look at doing as a group. The other thing that you could look at is like the Patient Protection Commission. They also get 3 BDRs every year, and that's something that we could bring to them to say, okay, how do we got these compacts, which are great. However, let's reduce the prohibiting factors.
Thank you. And the last question regards sort of the rural hospitals. As we know, there was a lot of talk about how the big, beautiful bill was going to impact rural hospitals and rural communities. And I just wanted to get your take on how that might be impacting the work that you all are doing with the last sort of bills that you brought forward there in the participation in rural hospitals. If the fear is that they're going to close, how do we sort of work around that, continue to keep them open and continue to move forward?
So part of the One Big Beautiful Bill is the $50 billion Rural Health Transformation Fund, which actually Medicaid has already pulled together a group, which the Rural Health Partnership is part of. We are part of UNR statewide initiatives, and some other organizations are pulling together to figure out how to apply for this. We understand that each state is going to get to apply. The good news is that what I'm hearing is that they're going to divide that money equally amongst the 50 states. So though we are a small state, we will get the same amount of money as a larger state, which is good for us. So we're hoping that funds will keep those rural hospitals from closing. We're still, actually, I think there's a meeting tomorrow afternoon. Every Wednesday, we're meeting as a group to discuss how best to apply for it. You get one shot at the application, and it's good for 5 years. So
thank you.
We will work with them to make sure that the rural hospitals don't close, because that will be tragic.
Looks like Miss Angie Wilson has a comment as well.
Thank you, Angie Wilson, for the record. And just to piggyback off the last conversation, just a couple of weeks ago, we were in DC, of course, meeting with the new CMS administrator and his executive leadership and Secretary Kennedy. And I think that one of the other things that they're looking at is tribal involvement in the $50 billion rural transformation funding. And so I heard, Nancy, some of the groups that are getting together, but I would encourage, again, this is a great opportunity, because I think that one of the things that CMS is definitely noting to us is the tribal involvement that they're also going to be looking for in the applications that come forward.
Thank you. For the record, Nancy Bowen. Thank you, Angie. I'll bring that to Medicaid's attention, because they're the one who are organizing meetings, and see what they plan to do around it. Because I think I can't name everybody off the top of my head, but I will definitely bring that to Medicaid's attention, because I think you're right. That would probably strengthen any application, and it's definitely needed.
Thank you so much, Nancy. Just recognizing Bishop Bonnie Radden on the call with her hand raised.
Thank you, Bishop Bonnie Radden, for the record. Thank you, Dr. Hickson asked 3 of my 4 questions, and my final question was, I couldn't write fast enough or even screenshot, Nancy. Thank you again for your presentation. Amazing. I was wondering if I can get the slides or the notes on all of the pieces of your part today.
Yes.
Could that be available to us?
Yeah, I can share that, and I can email the notes that I have to Tina, and Tina can get them out to the group.
Thank you so much.
Oh, you're welcome.
Thank you so much, everyone, for your questions, comments, and Nancy for your presentation. Very thorough and a lot of interesting policies that we should keep our eyes on. And outcomes of these policies that we should also keep our eyes on. So thank you so much for that. With that said, I'd like to move on to our next agenda item 10. This is for possible action regarding our future meeting dates as well as agenda topics. So we have 3 dates that we've previously discussed, and I wanted to confirm your availability for these dates. So first and foremost, we have our November 18th at 10 a.m. I believe we had quorum when we last addressed this, but wanted to reaffirm that. Additionally, we also have our February 10th, 2026, a ways away, but please let us know if this is something that you would not be able to make. And then finally, our May 12th, 2026 at 10 a.m. virtually. So with this being said, I know that we kind of talked about these dates, and many of us mentioned availability for these. With that said, I'd like to go ahead and ask if there are any concerns with these dates as they have been posed so far. I know some of these are a little ways away, so I'm hoping we're good.
Oh, sorry. This is Nancy Bone for the record. Unfortunately, those fall on 2 national conferences that I always attend. If as long as I can attend virtually, we can figure it out. And that would be November 18th. I don't think I was able to attend the meeting last year in November for the same reason. And then February 10th, I believe I am in Washington, D.C. for another national conference. But again, if I can attend virtually, I should be able to make it work.
Thank you so much, Ms. Bowen, for mentioning that, and thank you for your dedication in doing so virtually as well. With that said, I know that many of us, it looks like, can make it. Didn't hear any other concerns. So with that said, I'd like to ask for a motion to approve the dates. Ahead of that, however, I wanted to ask if there were any additional topics that any of the advisory committee members would like to be addressed at upcoming meetings. Hearing or seeing none. With that mentioned, I'd like to go ahead and ask for a motion to approve the upcoming dates as well as the current suggested topics that we have for November 18th, vulnerable road user, Department of Public Safety initiative update, as well as the public health infrastructure activities update on November 18th. Do I hear a motion?
P. Debs, for the record, so moved.
Thank you so much, P. Debs. Do I hear a second?
Bishop Bonnie Radden, for the record, I second.
So we had 2 seconds. I'll go with the one that was here in the room. Maggie Salas Crespo went ahead and seconded that. With that said, is there any other discussion that we would like to have about the dates before we move forward with the vote? Hearing or seeing none. All in favor, please say aye.
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 Aye. All opposed? Hearing no opposition, with that said, the motion carries. And then with that said, we'll go ahead and we'll move on to our 11th agenda item here. This is your second opportunity and final opportunity for public comments during this meeting. With that said, public comment may be taken during this agenda item. No action may be taken on a matter raised under this item until the matter is included on an agenda item, or on an agenda rather, as an item on which action may be taken. The chair of the Advisory Committee on Minority Health and Equity will place a 2-minute time limit on the individuals as they address the committee. The chair may elect to allow public comments on a specific agenda item when that item is being considered. To provide public comment telephonically, please dial 1-775-321-6111. Anytime after I've announced the period of public comment. When prompted to provide a meeting ID, please enter 343-446-289#. With that said, looking around the room for public comments, it looks like we have one here in the room.
Gwen Taylor for the record. I just had a question on the ACRN grants. If you want to be a member of this board, is that a conflict of interest?
For the record, this is Tina Dorch. Thank you for the question. Are you asking, can a person be on NOMHE's advisory committee and also be a member of the advisory committee for Resilient Nevada?
Oh, no, I'm sorry, Tina. This is Gwen. No, I want to know, you told me to look at the ACRN grant dollars. So if I look at the ACRN grant dollars, yes, would that prohibit me from being on the NOMHE board or the ACRN committee? It would not?
It would not.
Okay, thank you.
Thank you so much for your public comment. Nick Dunkel again, for the record. Ms. Gwen Taylor, thank you again. Do we have any other public comments either in the room or via our call?
Chair Dunkel, this is Alex Neal for the record. At this time, no one online has raised their hand or has raised their hand to indicate that they would like to provide public comment. Additionally, there are no more phone numbers on the call, so none from the phone line as well.
Thank you so much, Alex. Nick Dunkel, once again for the record. With that said, we'll go ahead and move on to our 12th agenda item, which is wrap up and adjournment. Thank you all so much for a very productive, constructive meeting. Sorry for the alliteration there. Thank you so much for presenting, being present, as well as for the public comments by the community members that have been present here. Really appreciate the noteworthy points that were made, whether it was from NOMHE's engagement activities to Ms. Dorch's outreach as program manager of this wonderful work that we're seeing here. Thank you again to all the NOMHE staff as well for putting on this wonderful event and for the folks that have attended it here in person. With that said, I would like to go ahead and request a motion to adjourn our meeting here today at 2:19 p.m.
Dr. Samuel Hickson for the record, motion to adjourn the meeting.
Thank you so much, Dr. Hickson. Do I hear a second? Thank you so much, PDevs, for your second. Is there any discussion ahead of the close of the meeting that we would like to have? Hearing or seeing none. With that said, I'd like to go ahead and take a vote to adjourn today's meeting. All in favor, please say aye.
Aye.
Aye. All opposed, please say nay. Hearing or seeing no opposition, the motion carries. Thank you all so much for being present, presenting here today, and for all of the wonderful information that we heard both from either public comment as well as folks here on the advisory committee or NOMHE staff. Thank you so much.
I just want to say, Bishop and Tiara, you were greatly missed here in person. I'm just going to say that for the record.
And Nancy. Thank you all so much.